All right, I'll call the meeting to the meeting of the Committee of the Whole on Tuesday, January 18th to order. Welcome, everyone. And I will look to Councillor Ma to provide the land acknowledgement.
Okay. Thank you, Mayor Crosshart. There's a daily newsletter that I subscribe to, and yesterday it pointed out that it was Martin Luther King Jr. Day for our neighbors down south. And there was a quote that was attributed to the civil rights leader: "Our lives begin to end the day we become silent about the things that matter." From the early days of slavery and eventual emancipation, the African-American struggle has made a winding road of progress. And while things have improved, there's a long way to go, but there is an arc of change. Much like how here in Canada, Indigenous rights and issues are steadily gaining momentum. Growing up, going to school, this stuff wasn't even on the curriculum. And here we are with my two daughters in grade 1 and grade 4. They get exposure, they learn about this stuff. They are literally not being silent about the things that matter. They remind us of the work we have to do. With that, I'd like to say that I'm fortunate and grateful to live vibrantly on the land of the Treaty 7 people, the Blackfoot Confederacy, Siksika, Kainai, Bagadi, the Tsuut'ina, Yahe Nakota Nations, Chiniki, Bearspaw Wesley, and the Métis Nation Region 3. And in the spirit of change, I'm committed to seeking truth and reconciliation.
Thank you, Councillor Ma. Very good words to remember. Thank you for sharing. I'll now look for approval of the agenda. Are there any changes? I'd look to admin.
No, there are none from administration.
Okay, then I'll move approval of the agenda for January 18th, 2022 Committee of the Whole meeting as circulated. All those in favor? Carried unanimously. Now we'll turn to delegations. B1. First, the delegation from the Alberta Health Services Ambulance Services.
Good morning or good afternoon, Mayor. How are you?
Thank you, Mr. Burska and Swanson. Well, why don't I have you introduce who's before us? And it's good to see you again. I saw you up in Edmonton.
It's very nice to see you. And I saw Lisa there for a minute. I thought Lisa was retired, but
no, we refused to accept her letter, and she's now confined to the CAO office. And anyway, she's agreed to stay on until her replacement is in place, which is in the near future. So we're very, very fortunate that she was able to help us or assist us in that way. So.
Well, thank you, Your Worship. I'm just going to spend a minute just introducing my team. The first member of my team is Curtis Swanson. Curtis, if you can introduce yourself, please.
Good afternoon. I'm Curtis Swanson. I'm the Director of Operations for Calgary EMS.
Thank you, Curtis. And the second member of my team joining us today is Rob Jabs. Rob, if you can introduce yourself, please.
Yeah, good afternoon, everybody. I'm Rob Jabs. I am the Operations Manager for the northeast part of Calgary, out through the Bow Valley corridor.
Thank you. What I'd like to do now, if everybody's okay with it, I'd like to share a brief presentation. And really what the intent of our goal is to give you an overview of the state of EMS in the Bow Valley corridor, specifically in Canmore, but really want to spend time, quick presentation, but spend time and open it up to questions and answer, because I know there's a lot of questions swirling around EMS about concerns to service delivery. And really that's the intent. I hope in our presentation we'll answer a fair amount of those questions for you, but really want to spend the time and make sure that you have a good understanding from EMS and that you're hearing the story from an EMS perspective based on EMS data and not necessarily some of the Facebook information that's out there. So I'm just going to share my screen here if that's okay with you.
Yes, great. That sounds great. And I was remiss in not thanking you for having accepted our invitation to come and speak with us. And yes, there are several questions, and we've been looking forward to this. So please proceed.
Thank you very much, Your Worship. I'm just going to share my screen here. Bring this up. Basic share. Any luck on seeing the screen yet?
Not yet.
Okay. For whatever reason, it's not letting me share it here.
Do you see the green share screen icon at the bottom of the Zoom?
Yeah, I've got it there and I've clicked on it and then I go to the share option and it's not giving me a.
So you have to click on the.
There we go. How's that? Technically challenged, so apologize for the delay. I'm just going to go to the presentation.
Great, thank you.
Okay. Really, the goal of the presentation today, we're going to talk about the EMS resources that start and stop out of Canmore. We're going to talk about call volume out of Canmore. We're going to speak about the ambulances that currently serve Canmore, the communities that are served by the resources starting out of Canmore. We'll talk about the most common transport destinations of the Canmore ambulances. And then we'll also talk to you about our response times in the area. From there, we're going to be very transparent and open it up to some of the challenges we're facing in EMS and what mitigation strategies we're putting in place to deal with these challenges. And then at the end, I'm going to open it up to a discussion and question and answer period. Again, the purpose of our engagement session is to share information from an EMS perspective. The information that you are receiving is data driven, so we'll be addressing it from a data perspective. Address any concerns that the councillors or community have, and looking for opportunities for improvement across the board. As far as EMS resources in Canmore, there are two 24-hour resources. The first one is a 24/7, 365 ambulance that works a 12-hour shift pattern. So they work a shifting pattern of 12-hour shifts. The second ambulance is again another advanced life support ambulance. They work 7 days a week in the same fashion. However, they are what we call a core flex. So this group comes in and has a specific core hours of work that they do. Then they go on to their flex hours, which means that they are on a callback perspective and available for service delivery. And then following that, there's downtime in between there where possible. The system supporting the two ambulances out of the Canmore location, we have a general hospital. We have medical first response, which I must say we are very appreciative of. Access to STARS for high acuity transfers and scene calls. And then we have currently registered in the community 14 AEDs. This seems a little low to us, so I'd like to work with the community after to make sure that we've captured all the AEDs that are present at the various sites throughout Canmore. This will allow us to, when a patient or a community member calls 911, what they will end up doing is it will be in the dispatch system as long as such. And if a AED is required, what will end up happening is the dispatch center will pre-warn the caller to go to the AED and gather it and bring it to the patient's side for use. So we're going to look at call volume now in Canmore. AHS works on a fiscal year, so the data reported here will be from April 1st of 2020 to March 31st, 2020. When the fiscal year resets, we'll provide at a subsequent presentation the following fiscal year to the group here today. We break it down into quarters, and what you can see is the total call volume from April 1st to March 31st of 2021 was 1,443 calls. When you look at it here, we consistently see a fairly steady progression in the call volume and fairly consistent. However, what is of note is that July through September is the busiest time for EMS in Canmore and surrounding areas. Currently, the ambulances that serve Canmore, these are the units that are responding to events that are located in or around Canmore. The Canmore resources do about 76% of their own call volume in the area. The next service in, which makes sense logistically, is Banff, and then the remaining 2 agencies are either Cochrane or Calgary coming in at a very low number into the Canmore area. The Canmore Resources, on the other hand, serve several communities. We work in a borderless system. That means the ambulance may start and stop out of a community, but they move throughout the Bow Valley corridor where the demand is required. So what we will see is the top communities again that assist Canmore, that come in to work with them, are Canmore again, Calgary comes in, and then Nakota and Banff. I'll just reiterate that so I don't make a mistake here. These are the areas that Canmore serves. So let's refocus that Canmore serves the bulk of its own calls, but at the same time, they do calls within the city of Calgary. And that will be presenting of one of the concerns that we've heard clearly from the community and will address coming up. The top destinations for transport.
Excuse me, Mr. Burska, I'm not going to interrupt your flow. I just wanted to know, will this presentation be made available to council so that we can not have to be worrying about missing something because we're taking notes and then maybe copying something down wrong?
Absolutely. You can have it right after. The information here is public information. I did want to preface it, though, just to make sure that we have the opportunity to speak to it so that people know what context to take it in. But by all means,
very much appreciated. Please continue.
Thank you. So the top destinations where Canmore Resources transport to, primarily at least half of the events are going to the Canmore Hospital. This is a positive thing in our view. Primarily because of the fact that it keeps the resources in community. Obviously, the second highest is the city of Calgary, and that's most often related to the services that are required by the patient. So if they are a trauma patient, for example, or a cardiac patient, they will come into the city to get that advanced level of care. Response times. Before I look at the response times, I want to speak to you about what our targets are. The targets for Canmore, the community, are 10 minutes at the 50th percentile and 15 minutes at the 90th percentile. So what you will see here is we're looking at 5 full years of data plus our current data up to the end of last year. And what you will see is that the response times are well within our target median of 10 minutes or less, averaging around 9 minutes and 23 seconds. So that's a positive thing. What you'll see at the 90th percentile, what you will see is that our target is 15 minutes. And consistently, we're having challenges meeting that, specifically related to the fact that when we hit this target, both resources are likely out on events, doing other responses, whether in community or outside of community, and we have to bring another resource into the community to do the response. I want to be clear that what we are looking here at is response times for life-threatening emergencies. So these are what we call our Delta and Echo events, which means these are life-threatening in nature, where we want to give the highest priority of our EMS response to the citizens. So we have 4 major challenges within EMS that I'm going to speak to you about, and I'm going to speak to you as we go through each one of them, some of the mitigation strategies that we're putting into place. The first is increased 911 event volume. Our normal increase over the past several fiscal years, so over the past 5 years, we've seen a 6 to 8% growth in our events per year. However, as of March last year, and being sustained from March till present, we've seen an unprecedented increase in our 911 event volume. We've seen up to 35% increase. This has been sustained, and it will now be our new norm going forward. For people in a service delivery model, nobody prepares for such an increase. We prepare for increases on a periodic time period, so we can sustain an increase for, say, 2 to 3 weeks of that magnitude. But when you're looking at a 9-month sustained increase, which will now be the future going forward, we'll need to address it through several different methods. Primarily, one of those is increasing the resources available to EMS to serve the public. So what are we doing about some of these things in the short term? The first thing is a lot of the volume that's created with either the 911 events or our interfacility movement out of the Canmore Hospital into the city of Calgary, which requires EMS transport because patient care is required. We're looking at alternative discharge transport options where we can safely transport the patient by other means other than EMS. Specifically, we would be looking at family, taxi, or community shuttles to move these patients, especially when they're low acuity and have very little care requirements. There is currently a trial ongoing in the rural setting up north, but my team has met as of 2 weeks ago, and we are putting a priority to moving this transport options to all hospitals throughout the entire zone. And the intent is to move it out within the next month so that we can gain efficiencies and keep our ambulances in community. The second thing we're doing, and which was implemented officially by a directive over a week and a half ago, is triaging our low acuity 911 events. This is where we look at the acuity of the patient, and we will delay a response to those calls. And we will do it in the following manner. We will do it for low acuity events that have been reviewed by a physician in dispatch. And then we will do callbacks to the patient every 15 minutes to ensure that things have not changed. They will sit in a queue until we have sufficient EMS resources to respond to them. So it's not that we won't go to the event, we will delay our response to ensure that we have resources available for our high acuity emergencies. So that's our first challenge, and that's some of the solutions we're implementing. The second challenge won't be unique to most people, and what you've heard is prolonged hospital waits. We've seen an unprecedented wait times in the Calgary zone that I've never seen in the entire time that I've been working in the industry. The first thing we're doing to mitigate this is raise awareness. What is very evident is that the emergency department and EMS are well aware of the challenges we face, but the hospital system as a whole is not aware of the challenges that are faced by EMS in the emergency department. Hence, there's not a priority placed on flow through the system. So that's the first thing we're doing by meeting with the hospitals and making them aware of the challenges we're facing. The second piece which we're implementing, and the target date for implementation of this is March the 1st, is the Integrated Operations Center. For lack of a better word, this is the air traffic control of the entire hospital system. What it will look at is the input, that's the amount of patients coming into the facility by EMS, and distribute them equally across all the 4 acute care adult hospitals in the city of Calgary. And then it will really focus on throughput and output, methods to increase patient flow once they're in the hospital, on the units, and discharging them in a timely manner. Curtis, I'll pass it to you to give an update on that, as Curtis is leading that from an EMS perspective. Curtis, go ahead.
Perfect. Thanks, Randy. Like you said, Randy, it's the air traffic control of the hospital system. And so we want to make sure that we're dispersing the ambulances appropriately, but also create a plan. As Randy talked about, we definitely have some challenges with long hospital waits, and we want to make sure we can get that truck back into the community. So it's going to be a coordination center that will take real-time data and predictive data and try to come up with the best plan to move that patient through the system. It also works on the output, which is to move patients out of the hospitals to create that flow in the system. We hope to, like Randy said, to have this moving forward by early March. And we're taking this out of similar IOCs, which is in Baltimore and Edmonton has now done a trial of it as well. So we're working closely with both Edmonton and Baltimore to see how this integrated operations center would work.
Thanks, Curtis. I want to be clear on when we talk about the Integrated Operations Center, this is not an EMS initiative. We're in partners with the hospital system, but it's a primary focus of ownership at the hospital level. And this is where we meet the challenges. We have very little control of moving patients once they're in the hospital system from an EMS perspective. Even though we're part of AHS, there are barriers there to get those patients moved throughout the system. The next area where we're trying to increase our movement of prolonged hospital waits is increasing transports to urgent care centers. We have urgent care centers in Airdrie, Cochrane, and Okotoks. We've done a trial with the urban centers. We started that trial in early August by increasing transports from our EMS crews to urgent cares for low acuity events. Was very successful, and we increased transports to that location between 35 and 40%. In November, we moved it out to the rural sites, and the pilot has been successful to this point. So we are actually moving low acuity patients to these locations and keeping the resources in community longer instead of bringing in the city for transport. So very successful. Curtis again led this. Curtis, do you want to add anything else on this?
No, like you said, Randy, it's a low acuity patient. Sometimes gets stuck with EMS and allow them to get the best care, which will allow EMS to turn around in community. The other thing related to this in the Bow Valley corridor is we're extending the hours of our IFT unit in Cochrane to 16 hours a day to try to pick up some of the transfers from Canmore Hospital and from the UCC to keep the 911 ambulance in community.
Thanks, Curtis. The projected date to that, I'm just going to be crystal clear, is April 25th. And you ask why so long? The only reason why it's taking that long, I have to abide by collective agreements, and I have to give my staff 12 weeks notice. The interfacility group just did their line selection where they want to work, in essence, over the next while, and I have to give them 12 weeks notice. So April 25th is a go live for that. Currently, there's one resource just working day hours, Monday through Friday. As Curtis said, we'll increase that for another 8 hours. So we'll have both a day and an evening resource. The whole intent is twofold: to keep the current 911 resources in community. And should the 911 resources go out of community, that resource can be utilized for both interfacility work and 911 work at the same time. So very positive thing that's coming down there. The next challenge we're facing is fluctuating EMS staffing levels. Won't come as any surprise to anybody on the phone. The pandemic has created numerous challenges for us. Our staff are fatigued, they're tired. We've had the highest WCB claims both for injury and mental health that we've ever seen in Calgary's own EMS operations. We've also seen our sick time increase dramatically during the recent waves of pandemic. And part of our mitigation strategies, we've increased our mental health resources available to our staff. And then we've just hired over 35 staff in the zone at a full-time positions to increase our staffing numbers. We also continue to hire casuals and temporary full-time employees at the same time. Of those 35 that we brought on, they were brought on in the months of September through November of this past year. The last challenge that we face is suburban rural resources coming into the city. This has been very evident throughout the last 9 months with our sustained increases in 911 events. And one of the big mitigation strategies we're bringing into play is a secondary triage system. This triage system will look at not only the medical priority dispatch triage system, which is the coding system we use to prioritize calls, but it'll also look at patient acuity in a secondary manner. So to give you an example, where this will benefit is twofold. First of all, for our staff at shift change, it will get our staff home in a timely manner, and it will also get our rural resources back to community. And how it will work is if the patient is stable in nature, we will allow for shift change, or we will allow the resource that was the the Canmore resource that was in the city of Calgary to return to community and not respond to a 911 event unless it's a life-threatening emergency, which would be what we call Delta and Echo responses. So this is going to be a positive thing. The update on this at this point, this information is being entered into our computer-aided dispatch system tomorrow, and we are waiting on a government announcement of when we can go ahead and implement it. It's been pushed back twice now, and we're hoping that that government announcement will come next week. But I'm going to be honest, don't hold me to that. All right. But we will continue to push this forward because we see it as essential going forward. But the government does want to present some of these changes and announcements as we move forward. So that's the short presentation. I'd like to thank all of you for the opportunity to speak to you, but we'd also like now to open it up to questions from any of yourself, Mr. Mayor, and any of your councillors. We'd be more than happy to address any specific questions that you may have.
Great, thank you very much. Really appreciate your presentation. I'd like to ask all councillors that are on the line to please go on video if you're able to. I know that Councillor Mero had some technical difficulties during that and fell off, but I think I saw her back on. And Councillor Ma also is trying to reconnect. So pardon me while we just wait here. I just want to make sure we still have quorum.
Would it help if I stop presenting?
Yeah, actually, yeah, that would be great. Thank you.
There we go. Well, hopefully that'll help.
Okay, there we go. I see that we at least have quorum here. So thank you very much for that presentation. Excellent information. And as I gleaned from you and the other gentleman that we, Ms. DeSoto and I met with in Edmonton during the Alberta Municipalities Conference, I was pleased to see the solutions that you're looking to implement. I was wondering if all of these solutions being implemented right now, or I mean, you mentioned the IOC is March 1st, and you mentioned the suburban rural the plan is waiting on a government announcement. Are all the others effectively, going into effect ASAP?
Yeah, great question, Mr. Mayor. And the answer is simple version is yes. So the dispatch solutions, there's actually 10 components to it, if you can believe. It's all staggered. It started with what we call delaying of the 911 events. That's where they're low acuity. It's moving now to what I call that secondary triage piece. And there's several components that will assist us in getting to where we want to be over the next 2 months. We have targets by the end of February to meet that. The challenge is, as I said, with the government piece that we're doing it, and I don't want to, please don't understand I'm laying blame here. It's just, we're ready to go on our side. It's just they want to announce some of these changes because they are quite big changes from an EMS perspective. So we feel confident that most of these changes should be in place in the next couple months. The exception is, as I said, is the interfacility piece, adding the extra car. That won't be till April. And as I said, my hands are tied on that one based on a collective agreement issue. And I'll be clear, that's a repurposing of existing resources. So it's not like I can add a new one and start it today, if that makes sense.
Before I go to other councillors who are patiently waiting, I just one thing I didn't hear touched upon in your report was the addition of more ambulances, more units. I know we had talked about that in person some months ago, but I was wondering if you could speak to, because I believe that the number of units haven't changed in a lot of locations for quite a while, and I was just wondering if you could speak to that.
I absolutely will speak to it. As of today, we continue to lobby the government for additional resources, but there is no new resources at this point on the horizon from the government perspective.
And then I understand that there's also, you've got the challenges you mentioned about staffing, but if you had more ambulance or had the money for more ambulances, I understand that there's a backlog for ambulances as well.
Yeah, so I'll put it into perspective. So it's almost what we call the perfect storm. So number one, we have a situation where our call volumes increased 30 to 35%, and it's been sustained. We have prolonged hospital waits because the whole healthcare system is affected in that manner. And I want to be clear when I'm telling you about these problems, they are not isolated to Canmore. They are not isolated to the province of Alberta, to Canada. They're an international problem that's facing healthcare and EMS globally. But to your point with the vehicles, the vehicle challenges, we have 40 million waiting and guaranteed to our ambulance manufacturers. We can't get the ambulances because they can't build the chassis based on production line problems. So there is 40 million committed to new ambulances over the next 2+ years, along with SUVs. Those are the Suburban or the sports utility vehicles that assist with some of our responses for our supervisors. Again, there's a problem in the production line plus a chip problem. And I'm not an expert in the vehicle side, but production chips for the computers in the vehicles is also a concern where we're having the problem. So it's the perfect scenario. You know, we've got a situation where we have money, but I can't get the products, the ambulances to put our crews into. They are trickling in. They're starting to come in, but this is, as I said, is a global problem that all EMS systems are facing, and we're all wanting to get to the front of the line.
Okay, thank you. Councillor Faubert.
Where are we up top? Okay. Sorry about that.
No, it's all good. Thank you, Mr. Mayor. Thank you, Mr.
Randy.
Thank you, Randy.
Please. Yeah.
I am pleased to hear about all the efforts being undertaken. Like any complex problem, solutions are going to be multifaceted and across a number of different aspects of this system. I have two questions.
Sure.
One with regards to transfers and one with regards to the review dispatch model.
Yep.
With regards to transfers, is there any progress in extending the hours for the CAT scan at the Canmore Hospital? Because as I understand it, evenings and especially weekends, with the outdoor recreation we have here, the use of that machine could prevent, mean that there are less transfers needed into the city.
Okay, I'll address that question first. I'm not an expert in that area. I do know from speaking with my colleagues that there is a lot of lobbying going on to expand the hours. So I will have to defer that question, and it's not an area under my control. I can tell you your EMS system, specifically myself and my leaders on the call, we are lobbying heavily also to increase the hours because it will keep the resource in the community. So the last I saw was about 2 months ago, some discussion about the likelihood of hours. They were just looking at how they would be able to staff that. That's the best I can tell you. Sorry about that.
No, the fact that it's a conversation and being recognized as a solution is excellent news. With regards to reviewing the dispatch model, when you talked about that secondary triage, it sounds like that's really on the second half of the scenario where an ambulance goes to Calgary from Canmore and it's being sent home. Is there any work reviewing the model when it comes to dispatching ambulances in a regional perspective out of the valley? Because that definitely is part of the conversation and concern.
Yes. So to answer your question, simply yes, we're looking at both sides of the model. I'm not the expert in dispatch, so please take that. If you guys would like, I'd be more than happy to bring a dispatch colleague the next time we meet. But we are looking at all options of how we're going to manage both dispatching units out of the Bow Valley corridor, and then once they get into the city of Calgary, they do the emergency response to get them out in a timely manner. Now, I'm going to be transparent here. We likely will not get you every resource back into your community the way everybody would like to see it. So I'll give you the example. You'll go in, do a call from Canmore, take a Canmore patient to the city of Calgary. There is a probability if a life-threatening emergency comes in based on ethics and the best response, we want to make sure everybody has access to 911 care. But if it's a low acuity event, and I'll give you an example, I have somebody with back pain for 5 days. That call would be deferred. It would be deferred for a Calgary resource. The Canmore resource would come back to community. Does that answer your question, Councillor? Sorry. Okay, thank you.
Look to other councillors. If anybody has a question, Councillor Ma, and then Councillor Hillstead.
Thank you so much, Randy, for hopping in. Apologies for hopping out there. My Wi-Fi just died and I had to reboot a router. So if this question has been asked already, I apologize. As you noted in some of your early parts of your presentation, we have a particularly busy time during our summers.
Yes.
The first season and the weekends and some of the seasonal stuff. Is there any possibility for some sort of slightly different approach from you guys during our hectic months?
That's a great question. We're open to it. It's just the resources to staff right now that I'm facing. Rob, have we done this in the past? I know we've done with the ski hills and stuff like that over the winter months. I'll ask my colleague Rob to comment if we've done anything specific over summer.
No, when you kind of look at your guys' call volume over the course of the year, it's actually, there is not a kind of massive acceleration or increased numbers of calls over the summer. Your call volume is actually pretty stable over the course of the year. And when we look, one of the things we measure is actually the unit utilization. So, and when those numbers start to climb, it's how much of the time is your truck is it in the community, and how much of the time is it on a call? And the resources that we have in Canmore sit on calls about 23% of the time. So when we start getting concerned, it's based on when we see those numbers starting to climb significantly, and we have increased difficulty basically getting to the calls. But the unit utilization in Canmore has actually been fairly stable for the last 3 years. So it's not like we're seeing a huge spike that has required us to add additional resources. Now, one of the things that, the other thing too, is we do have resources in Banff and in Nakota, as well as Kananaskis, that will buffer the system in Canmore, just like you guys kind of buffer some of the other communities when we have those anomalies where you have a day where we have a spike in call volume. Because obviously when we're talking averaging here, there will be days where, if we have 5 calls come in within a 5-minute period, it can potentially overwhelm the resources that you guys have within the community. And that's where we kind of will shuffle a resource from some of the surrounding communities in to respond to those calls. But from kind of a resourcing perspective, the numbers just right now are not really increasing to a point where we would be looking at probably adding resources there. There is, for example, we've got other locations kind of in the Bow Valley that we've got probably we'd have to be looking at first. So,
thanks, Rob. And Councillor, I'll just add, we've done modeling, and the next resource coming into the Bow Valley corridor will likely come to Lake Louise. We currently have no resource there in Banff serving that. It's a high drain on the Banff resources, which creates a shuffle. Banff goes out, Canmore goes over, you know, exactly. You've got it. So the next resource coming into the Bow Valley corridor from a perspective of if and when we get, and I'm hoping the when is soon, but again, out of my purview, we continue to lobby for additional resources, but right now it's out of the purview of my team. The modeling shows it's to come into Lake Louise along the Bow Valley corridor.
Do you have a rough date on when that might be? Best case
No.
scenario, Randy?
No, I don't. It's funny. We had resources allocated originally with the NDP government, and then the change in government shuffled resources to alternative sites after that. So it's very dependent on the government and what they say from a perspective. We are prepared from a data perspective along the Bow Valley corridor. That's the next location where we need to put a resource. And whether that's a full-time resource or a 12-hour resource, that's dependent on what the modeling shows when going forward. Okay. Sorry, I wish I could add resources across the whole spectrum of the zone right now, because we sure could use them, but I don't have the luxury of that right now.
Yeah.
Just before going to Councillor Hillstead, I just wanted to ask about the data. You presented data to us on full years to your fiscal year end, so to March 31st, 2021. But when you're doing this modeling, you're of course using, you know, your absolute most current data as well, right?
Absolutely.
Okay, it's not always a year out. Okay.
No, our modeling is based on projections within the month that it turns. So we'll use up to that full month of data. And we go back historically up to 12 years we have an opportunity to go back to now.
Great, thank you.
So, which is really going to drive from a historical perspective, and it's fairly accurate on its predictability.
Great, thank you. Councillor Hillstead.
Thank you, Mayor Crowsert. Thank you all for being here, presenting to us today. This question was partially answered earlier, but so when the ambulance that are in Canmore pick up a patient in Canmore and then drive to Calgary, is it more likely just when those times when the ambulance are in Calgary that gets stuck in Calgary than compared to if the ambulance is in Canmore and then actually driving just straight to Calgary for a patient there? Or how does that work? Because I think there's concern that, you know, it's not just because again, I didn't quite think about it until you brought it up that, yeah, a lot of the times a patient gets picked up in Canmore and they have to go to Calgary because that's where they need to be treated. So how often, or do we have data on how often an ambulance just leaves Canmore to go to Calgary for a call instead of already being in Calgary because they dropped off a patient there? And how do we have data on that?
I don't have data right in front of me today on it specifically, but what I can say, the majority of the calls occur when the Canmore resource comes into Calgary and then it gets what I'll call stuck into Calgary, right? Because they're doing multiple calls based on acuity. Currently, we're sending them to any event, right? So a low acuity event, a high acuity event, we're sending them to all. What we're saying in the system that's coming online here very shortly will be that the only time that Canmore resource will be responding is to something that's life-threatening. Otherwise, the intent will be get that resource back to their community.
Thank you.
But I want to be clear, and I don't want to pull wool over people's eyes because that's never our intent. Our intent here is about transparency. There are times where a Canmore resource will legitimately get dispatched out of Canmore to come to Calgary on a response, and you say that's crazy. You're right, it is, but the fact is, it's the way our system works today. What we see is that truck will start to roll down the highway and then get canceled because another resource becomes available in Calgary. But we want to make sure that we have a resource going to specifically the life-threatening events, if that makes sense.
Yeah, thank you.
You're welcome.
Councillor McCallum.
Oh, over there.
Thank you, Your Worship. And I apologize. My internet has been in and out for most of this meeting, so I may have forgotten or missed some of what you have said. I'm sorry. So you speak to lobbying for additional resources. Who exactly are you lobbying, and what is their response when you provide them with all this data that says that what we're providing is inadequate?
So great question. We've presented to every MLA in the entire zone. And then that's at my level. So the
So
chief,
including MLA Rosen, our MLA.
yes,
here.
your MLA Rosen,
Sure, yeah.
we've presented to. And so we've presented to MLA Rosen, we presented to all the MLAs that surround the city of Calgary. We've also presented to almost every community in this Calgary zone now that has a start-stop location. After that, my chief is now lobbying along with the CEO of Alberta Health Services, the ministry. And that's
So
outside of my purview,
Yeah.
you know, but that's where the lobbying is occurring. One thing that will help put things into perspective, the former health minister, Mr. Shandro, gave us a very clear mandate on his way out, was that we were to create an EMS service plan, not for current and the next 5 years coming up. Excuse me, my dog in the background. So we've embarked on that. The service plan is to be prepared for delivery by September to the government. And that's where we're looking at multiple resources being added into the system. My team is currently working on a specific ask to the zone for brand new resources in twofold. Number one, existing resources we're putting on over our funded numbers. So currently we put 2 Metro ambulances on over our number, every day shift and every night shift, where staffing will allow it. We put 2 IFT resources Monday through Friday on, 2 net resources, those are the low acuity transport vans on, and we look at extra staffing throughout. Plus we put on paramedic response units in the city of Calgary. And you say, Randy, you seem to be focusing a lot on the city of Calgary. There's a reason for that. The demand is so high out of the city of Calgary.
Yeah,
that's
they're
what's
robbing
causing all the
from the
resources.
fringes. No, I get it. It's, yeah. And to be fair, when we divested from ambulance in Canmore, I was actually a baby counselor at that time, 10 years ago. We were suffering from that then. So I'm wondering what's changed. Have we received more buses since we divested in 2012? And more staff? Have we tried to solve the problems that we were suffering from at that time, which is 10 years ago this year? How's that going?
Yeah, the loaded question. We haven't been resourced really new resources since 2009. The resource complement has been relatively the same. We've made changes. Probably the changes is repurposing interfacility transport resources into community to buffer that. But we're exhausting all our potential resources of reallocating within our existing system. Right now, what we've got to do is we need an infusion of new resources. One of 2 things needs to happen. We either need to get out of the hospitals in a more timely fashion with our resources, or add new resources. The true solution is doing both, getting us out of the hospital in a timely manner, and we're working on that right now. We're putting forward a proposal to have a maximum of 2 ambulances at any site at any given time, and that's it. That's almost a drop in the bucket compared to what we have now. For example, over yesterday, we were challenged severely with resourcing across the entire zone. And we went to our hospital colleagues and asked them that we implement a no wait policy as of yesterday. I can only go to this well so many times for that, because they're facing the same demands we are. We were relatively successful in doing that, but now we're looking at it's not realistic for us at this point to say take the patient in and drop them off. And the reason why I say that, from an ethics perspective, the patient acuity is so high that we're dealing with, it would be against paramedics' ethics to leave them in the hallway, even though there's care close. That's how critical some of these patients are, and they're waiting with us. So did I answer your question?
Yeah, so if I can paraphrase from the actual question, is that when we divested from ambulance as a municipality in 2012, we were working with 2009 resources at that time. So we were under-resourced at that time. And as our population has increased and visitation has increased, and we've endured a pandemic, our resourcing for ambulances locally, not just in Canmore, but Banff, as well as Lake Louise, we've actually, it's kind of like inflation. We're losing money. We're sort of, our population is increasing, we're getting busier, and we still have the same resources that we had in 2009. That's pretty much understanding that you've been trying to tweak and change and all those things. But from a financial perspective, in terms of boots on the ground, buses, the things that we need, we're dealing with 2009 resources.
Yeah, to my knowledge, we have not increased resources since you transitioned over to HS. Curtis,
and I'm sure you know what that means for our fire department, that our fire department is, so basically Alberta Health Services is bolstering their system on the backs of municipalities' fire departments. Is that a fair?
You know,
say?
Yeah, I'm not a good politician. So,
no, I'm not either.
You know, so which is a fair comment.
Terrible politician, actually.
Yeah. First of all, we absolutely appreciate the work that your fire department has done for us in the community. The challenge we're facing is the medical first response program is driven in essence by the community. So we have limited say in what you will go to and what you don't. In other words, your municipality controls what.
Yeah, we set the service. Absolutely.
Exactly.
We set the service level.
Yeah, but the reality is we are relying heavily upon the resources in the community to support us going to events. So it is a challenge, you know, and it will continue to be a challenge going forward. You know, I that's about all I can say. And resources, again, we are doing the best we can to get additional resources, but to date, we have not been successful in that area.
And so my last question, Your Worship, as a municipality elected official, as well as my neighbors who are common citizens, what is the best course of action on our parts to try and push this resourcing agenda forward?
I guess from perspective, and the advice shouldn't be coming from me, but I'll say it anyways. I think we need to continue to lobby that the provincial government for the existing for new resources, and that to me is what we'd love that support from. You know, that's really all I can say from that perspective. You know, my team is doing the best we can with the resources we have available. We're repurposing where we can, but there's a limit to that, right? And it's showing the strain on the system's never been greater, and we continue to be strained. We're hiring as many people as we can, you know, that are available to do work in the EMS sector. It's not like the concern that we have, and if for those who don't know the profession, I can't just hire somebody off the street to do the job.
Yeah, no, we have
to
similar
step
issues
through all
with,
the
yeah.
education pieces. So there's a limited pool that I have to select through. We are working now with the schools more so than we've ever been about lobbying for increasing numbers. We are also working with advanced education to increase the funding for increased practitioners to come out. So those are other things that we're doing at this point to continue to say that we have a sufficient pool of resources going forward.
Thank you very much.
You're welcome.
Thank you. I have a question around our cross coverage. My understanding is that Cochrane is sort of part of the cross coverage that Canmore and Banff and Kananaskis and stuff would have. And I was wondering, is there any way that there could be some movement on that? I mean, Cochrane's 75 kilometers away. I'm wondering does it actually make better sense for communities in the Bow Valley and for also care in Cochrane? I mean, there's something about the population draw that you're talking about. I know the gravitational pull is to Calgary. Yep. Because of population, but I'm wondering if does it make sense pulling a unit out of Canmore to go to Cochrane?
Yeah, so what our plans are designed on is really to look at Calgary as a separate entity and look at the Bow Valley corridor as a whole. That's what we're trying to say. Until we get the changes with dispatch, the system is going to continue to draw into Calgary because of the demand, right? Yeah. And we're saying that's not right from our perspective. We've got to keep resources along the Bow Valley corridor to ensure that we have proper resources to take care of the citizens along the Bow Valley corridor. So we always look at our what we call our system status management plans. Those are our plans along the Bow Valley corridor, who backs up the other resources. There's pros and cons. The pros which we've seen with this is in the past, we used to have mutual aid agreements. I'd have to phone you up to send the resource over to my community. That doesn't happen anymore. The downside is the system is so dynamic now, it's drawing resources and changing all the time, to the point where the human can't keep up. And that's why another initiative that we're doing is it's going to automatically, through the computer, reallocate resources to the next highest level of call. So you may start on a low acuity event and you're getting close to it, but you will be redirected to a higher acuity event. Those things are all going to occur with these dispatch upgrades.
Correcting that, you mean?
Yes.
Yeah. Okay.
In an effort to correct the problems that we're seeing today.
Right. Yeah. Because that sounds a little chaotic.
Yeah. Well, the system is so dynamic right now, Mr. Mayor. It is such a fluid system. And unless you see it on a regular basis, you will see that it will change within seconds. That's how dynamic it is.
Yeah. I can believe it. With regards to interfacility transfers, yes. You mentioned for, I think you said in your slide, for discharges. I'm wondering, are there other also interfacility transfers that are, just sort of a low acuity, not endangered life, but you're needing to get from one facility to the next, of using private ambulance? Is that part of the solution?
Well, it is. We've got there's a couple things that are challenging. It's actually more expensive to use a private provider, but it does keep the resource in community. So that's what you have to weigh, right? Currently, we are looking at community resources out of Willow Creek, for example. They have a transport society. We're looking at those options elsewhere in the system, but right now, that's the system we're using to say, if the patient requires care, that's an EMS call, right? So we need our providers and our caregivers. But if it's a low acuity event going for, let's say, a orthotics appointment, a foot appointment, that can go by another care provider, either family. And that's part of our problem. Our hospitals are conditioned to call EMS. because it was revenue for them before, and it generated revenue for the EMS provider. So we've created kind of the challenges we've got today, you know.
Yeah. So I was going to go ahead.
Go ahead. No,
well, I was just going to actually go right there. And my understanding is that a lot of the interfacility transfers, I mean, they're initiated by the attending physician, by the emergency room or the hospital. And, you know, there needs to be perhaps some more triaging there as to send the unit, you know, the emergency response unit into Calgary, or call up the private transfer company. And my understanding from, and this is secondhand information, but from you know, an EMS paramedic is that there is funding for these private transfers, but it's mostly around education of the hospitals themselves, you know, making sure that they're aware of those possibilities. I was wondering if you could comment on that.
Yeah, I'm not sure in where the funding, the idea of extra funding is coming from. If there was extra funding, trust me, I'd be using it, you know, in every capacity. So I don't see the extra funding that you're referencing. What I do see is a need to educate other healthcare providers, physicians, nurses, on when it's appropriate to use an EMS transport. And that's the project that we're undertaking right now that's going to go zone wide. Because there is the belief that if we've initiated patient care, lots of physicians believe and nurses believe that we have to continue that with an EMS transport. That's not the case. We've clearly demonstrated family and or taxi. A shuttle bus can take the patient safely to the hospital in multiple of these cases. So.
Okay, and you're, as you said, that's currently underway about reprogramming the thinking in that regard.
Yeah, it is, and it's probably one of our top objectives for this year. And I say this year, what I'm talking about within the next couple of months is rolling it out and doing the education piece. It's educating, and that's where I said the awareness piece of the challenges we're facing in EMS and what is the proper way to move a patient safely. And that's what we have to get across to our physicians. Everybody believes, physician-wise, that you need an advanced life support unit to transport these patients. What they don't realize is the minute we use it on a low acuity event, we take that ALS resource, the advanced life support resource, out of the community. And that's where we have to get that balancing act occurring.
Great, thank you. Councillor Mah, you have a question.
Kind of further to your point there, your worship, Randy, is there any possibility down the road of like re-looking at how the zones are defined? Like when you say like the Bow Valley region, like I think Calgary and Cochrane geographically, they're relatively quite close in nature. You know, it's like half an hour to get Calgary to Cochrane, whereas for us to go Canmore to Cochrane, we're looking like 55 minutes. Is there any appetite towards changing that sort of zoning perspective so that we can have a little bit more of like a more defined Bow Valley region? Mm-hmm.
Yeah, to be quite honest, Councillor, I don't see that happening. The geographical breakdown within the zone has been defined by AHS. Doesn't mean we in EMS can't change some of the parameters. And that's kind of what we do when we look at the Bow Valley corridor as separate. That's what we've been trying to do. We have several transport corridors, I'll call Highway 2 north and south, and Highway 1 east and west. Those are kind of how we divide it up from an EMS perspective, but that's the degree that we've done it along so far. There's no doubt we need some infusion of resources along the corridor because our limits with event volume and the fact we only have a finite amount of resources continues to challenge us. So we will always look for system efficiencies where we can, and that's why we review our dispatch plans, a way we manage and send our units out yearly. And we also look, anytime we have those over goal responses, like you saw where we were at the 90th percentile, our events were high, we look at every one of those calls every 3 months. And we say, what could we have done differently? Why was the response time long in that scenario? And what could have we done differently to prevent it from happening? And that's where you see a lot of these tweaks coming from, is a review of that data.
Okay, and this is a question like I appreciate how you guys are trying to change the whole acuity scope. So it's, hey, like, this is not like a high profile emergency thing. We don't need to pull an ambulance on that right away. When you guys are like, I think that's a positive change. Is there like modeling on your end that can show the degree of positive impact that will create?
Yeah, we actually modeled these systems off of BC, and I'm trying to think where in the Europe. This secondary triage system has come from those ideas. We're tweaking it to meet our needs, but it's based on evidence from other areas. So all our stuff that we do comes from data, and then we look for evidence-based before we move on stuff. That's why it takes a little longer, I'll be honest, but from a patient safety perspective, that's the best way to do it. Okay. I think it was Thailand, if I'm not, Rob or Curtis, do you remember where the second piece, it was BC and another, maybe it wasn't, maybe not Thailand, but I just can't remember offhand where it was. But that secondary triage is in place there and been very successful in making sure that we keep resources in communities where they're needed elsewhere than just sending them to every call right away as it comes in.
Thank you.
I hope that helps.
Yeah, a little bit. Sometimes I was just curious, like, hey, like, maybe the computer model's sophisticated enough to say that, yeah, if we like implement these sort of changes, maybe ambulances working off of past data will be X amount more likely to be in our region, or like the sort of data or thing that we can like go back to constituents and say, hopefully we'll see like a 5% improvement or whatever you want to use the basis. That's all.
Yeah, I don't have the data in front of me. We use data analytics to make the decisions. We have a complete department that does all that for us, but I haven't seen specifically what percentage we'll see.
Yeah. Okay. Fair enough. Thank you.
I just have one more question, and that's around communication with local paramedics. It seems to me that a lot of the concerns and information into communities is coming from local paramedics, and that gives it credibility in the sense that it's the people that are on the ground doing it. And so you've discussed a lot of potential or solutions that you're working on, and I'm just wondering what sort of buy-in or involvement do you have with local paramedics to make sure that they're in the loop?
So one of our challenges is we haven't done a good job in the past of communicating the change we've done, and that's a focus for us, is getting out in front of our staff. The challenge is the staff are isolated on their specific area that they're serving, and everybody knows that there's a bigger picture, and that's what we need to educate them better on, is that there is a bigger picture than just that community you're working in that day. So we need to do a better job in that. Communication is an area where we do need improvements on, and that we've made a commitment with my team to do it going forward, and to explain to them what the rationale is right now. We currently have key messages when we go out and speak to our staff, that we review exactly what we're talking to you today about, is what they get in our key messages when we speak to them.
Thank you. Just looking to my council to see if there's any last questions. Seeing none, I just once again want to thank you gentlemen for joining us today. It seems to me that without a doubt, I mean, EMS acknowledges that there's a problem, like you say, not just in Canmore, but across the province, and that you're working within your system constraints to find solutions. And I certainly appreciate that. And it sounds like there's some good potential solutions that are being implemented. And what I'm hearing is that the resources for EMS have not increased in over a decade, and that is also a major parameter in which you're you're having to work within. So thank you for that information. And just so you know, this council, in addition to inviting you here, has supported increased lobbying efforts by myself on behalf of council with regards to the province. And I know that our community is not alone in that. And there's a number of communities that are looking for those additional resources for you. So thank you. And hey, we wish you all the best in implementing these changes. Lives literally are depending on it. So thank you.
Thank you, Your Worship. It's very nice. We will commit, my team and I, to coming back to speak to you on a regular basis. We are in a process. We'd like to do it at least every year so that we would do it. We would also do ad hoc if you require it. Rob, the manager for the District 2, which we call it, is responsible for the Bow Valley Corridor. You're more than welcome at any time to reach out to him, to Curtis or I, should you have questions. I would prefer that you guys come to us. There's a lot of information out in social media, as everybody's aware. It's got some accuracy and a lot of misinformation. And I'll be honest, we've done a very poor job in AHS in managing this. And it's an area where we continue to talk to our leadership about getting the message out and making sure that people have the AHS story, if you understand where I'm coming from. So thank you today for the time. We look forward to seeing you future. And if you do have questions, concerns, please reach out. And I know, Mayor, you've demonstrated you have no problem on doing that. So it's greatly appreciated.
Great. Thank you very much. And we look forward to receiving your presentation as well. You gentlemen have a good day and stay safe.
We will. Anywhere specifically you want us to send it to, Mayor?
If you could send it to the clerk, Ms. Hyde, okay, or Ms. Jones, who are liaising with you, that'd be great, and they'll distribute it to us.
We'll take care of that for you, sir.
Great.
All the
Thank
best.
you. Thank you very much.
Thanks for the time.
Great. Thank you. We'll now move to item B2, Bow Valley Food Alliance delegation. And look to our attendees to make sure that we have our guests here. Very good. Okay, Michelle and Lauren, you have the floor. Welcome to council, or welcome to the committee of the whole.
Perfect. Thank you for the welcome. I'm just going to share my screen here.
Oh, and I see Avni as well. Michelle, Lauren, and Avni, welcome.
Perfect. And just a thumbs up if we have this on full screen. Everyone can see our.
Absolutely.
Great. My name is Michelle, and on behalf of the Bow Valley Food Alliance, I want to thank the mayor and council for this opportunity to deepen our understanding and connection to the food charter. So the Bow Valley Food Alliance, to give you a little background, we are a network of food-focused and food-interested, not just organizations, but individuals, not-for-profits and businesses, agencies and municipalities. And we're all coming together dedicated to address food sovereignty. So that looks like ensuring there's enough food for all, creating connections with food, and ensuring our community members can determine what their food system looks like for them. We do this through a number of ways, connecting people, that's all ages and all stages of life, inspiring action, coordinating efforts, just like that previous call, and advocating for change, as well as opportunities like this and educating.
So in addition to food sovereignty at the Bow Valley Food Alliance, we also use the idea of food systems to think about our work. And this means we try not to focus on just one aspect of the food system, but rather to think about how all of these parts are connected. So you can see the little circular graphic on the slide there. And so we're really thinking about everything from food production, whether that's growing, hunting, gathering, to transporting, to cooking, and then to disposing of food, whether that's composting or in the landfill. And we really believe that if we want sustainable, equitable, and resilient communities, that we need to ensure that all parts of our food system that our communities rely on are sustainable, equitable, and resilient. So we're really thinking about sort of a multifaceted approach that involves many different players, sectors, and groups. And so we've also heard from Bow Valley community members that this kind of food systems approach is important. And we heard this during the 2 years that we spent consulting with community members starting in 2018. And we did this community consultation through community conversations and take-home kitchen table talks. And we used these conversations as the basis for developing the Bow Valley Food Charter. I was the postdoctoral researcher who helped compile and analyze all the notes from the conversations and the take-home kits. And then I worked with some qualitative software as well as the Bow Valley Food Alliance board to identify key themes and summarize them into what now is the charter. And so that's how we came up with all those different values, was identifying sort of the key things that kept on coming up through those community conversations. And so we were winding down the food charter process right when COVID began. And for us, the food charter has really been important as an organization who, like many, really had to think quickly on our feet throughout this pandemic. And we've really felt like the charter has given us confidence to feel like we're better able to understand and better positioned to understand communities' wants and needs in a really quickly shifting context. We were and still are in some cases getting a lot of asks and requests from local groups about, how do we meet communities' food needs and how do we ensure that no one in our community goes hungry. And we're still getting those requests. And they were also present before COVID as well. We've just seen an increase in food insecurity throughout the pandemic. And so throughout this whole pandemic and hopefully as we move forward, we've referred to the charter consistently, particularly when we had to make decisions, for example, about what to apply for funding for and how to best offer support for grassroots groups within our communities. The charter really a guiding document for us throughout uncertain times. And it was important because, again, we were drawing all of these ideas from community through the charter. And so our hope in presenting the charter to council and asking you to sign on to the charter is that we've seen how really useful the charter can be in helping to make decisions, as well as in advocating for change and in imagining how our communities might look in the future. So we really appreciate the attention that the town of Canmore has already given to food-related issues, everything from food waste to the ways that fruit trees and berry bushes can act as wildlife attractants. We also appreciate the town of Canmore's recognition that food is extremely expensive in Canmore, particularly in comparison to elsewhere in Alberta, as well as nationally, and that the high cost of food is one factor that contributes to the extremely high living wage in Canmore. And of course, we'd be remiss without also recognizing the work done by FCSS. We've been working with Lou on the food charter, and she's here as well today. And before Lou, we worked with Megan Imrie. So we've really appreciated all the work that the town does and has been doing that relates to food. One of the things that we've also seen in our communities is how closely food is linked to housing. We've heard repeatedly from some community members who face the choice of paying for rent or paying for food, which is absolutely a choice that no one should have to make. So in this context, we believe that the charter has the potential to act as an extremely useful framework for council and for administration in helping to make decisions, as well as to understand how to incorporate food into further areas within the town's work. And we think, again, that this charter is a good basis for doing so and for doing this kind of work and guiding decisions because it was developed in consultation and within community. We also think that the food charter provides a useful framework because it provides common ground to work with other municipalities as well as groups across the Bow Valley. And by working together across municipalities and across sectors, we really believe that this is sort of an important part of supporting the development of regional food systems, which we also see as really important in making our communities resilient, particularly in times of emergencies or unexpected situations such as COVID, but also in terms of events like the 2013 flood. So I'm going to pass it along to Avni now. And yeah, thank you.
Thanks, Lauren. So thanks for inviting Michelle, Lauren, and I to talk about food in our community, which I hope gives your minds a bit of a break with all that our town is going through at the moment. Food is fun. My involvement with the Bow Valley Food Alliance has shown me the value of collaborating across communities, nonprofits, businesses, community members, agencies, just to name a few. And the food charter has been integral in establishing a framework to guide our discussions. And honestly, for myself, also in my own mind and heart. So I'd like to take you back to 2010. I had only recently moved to Canmore and wanted to turn my backyard into a community garden. One sunny Saturday, 20 eager folks descended on my backyard to begin constructing Canmore's first community garden. The image that holds a special place in my heart is when 2 bike riders showed up with loads of manure in their chariots. That's when I knew I had found my people and my community. Fast forward to today, when a tiny little virus paused the world and allowed us to ask big questions about how we live on this planet. It has given us the time, space, and permission to question our current hierarchical, patriarchal, and colonial systems. These are big, overwhelming concepts, but locally, we can see the effects through the lens of food security. The most vulnerable in our communities are unfortunately the ones who experience the effects first. One of the programs that the Bow Valley Food Alliance helps coordinate is a Good Food Box, which is designed to bring affordable produce to Bow Valley families as a box model. At the outset of the pandemic, demand exploded. And almost 2 years later, in November, 340 boxes went to Bow Valley homes, which was very interesting during coordinating all that during the zombie filming. In my 20s, I developed my belief that small business is the foundation of our economy. And with that belief, FarmBox built relationships with small-scale organic farmers in Alberta and BC and set up logistics systems that continue to this day.
Excuse me, Ms. Silmer. I just wanted to give you a time check. You're at 9.5 minutes.
Okay, thanks. The pandemic highlighted that direct relationships and shorter supply chains are more resilient and nimble. These days, I use the food charter as a guiding document for the dialogues as a member of the Canadian Food Policy Advisory Council and board member of Alberta Food Matters. The Bow Valley Food Charter helps to frame discussions at a national, provincial, and regional levels. Literally this morning, I was involved in discussions for a national school food policy, as the most recent federal budget has committed $1 billion per year over the next 5 years to school food programming. That funding will only be allocated to those communities and models that are ready to receive it. An important step in demonstrating that Canmore is ready to receive funding like this is for council to sign the food charter. There is so much work to be done locally to create these programs with care, intention, ethically sourced food, local resources, local champions, and local relationships.
Thank you, Avni. So just to end one sentence, we really see this work as being the responsibility of all of us. And if council chooses to sign the charter, we think it'll show that you're behind the values laid out in the charter and that you firmly support this community-based, community-developed vision for food systems in the Bow Valley. So thank you so much for your time, and we're happy to take any questions that you might have.
Great. Thank you very much to the three of you for your wonderful presentation, as well as the materials that you provided that are in our agenda package. I'm sure that there's a couple of questions. I should just say from a personal note, I know I've been involved in some discussions in some years back because of my involvement with Canmore's Food and Friends program. And I really appreciate how much work has gone into getting to where you are today. So fantastic. I'm just wondering who else in the Bow Valley has signed on to the charter?
Lauren, do you want to?
So far we have the town of Banff signed, as well as ID9 in terms of municipalities and municipal districts.
Yep.
And then we do have like a list of individuals and businesses and organizations. And we're also happy to provide some letters of support from different groups if you're interested. But there are probably too many to list right now.
Right. Yeah, I was mostly wondering about the at municipal level, so thank you. Look to council. Councillor Faubert.
Thank you, Mr. Mayor. Of course, I have a question. Thank you so much for your presentation. I always enjoy connecting with the Food Alliance and talking food and food policy. My question is for each one of you. In addition to signing the charter, if you could, what would be the #1 issue, funding, or policy thing you would want council to address related to food security, food sovereignty?
I might go first. So it has evolved over the years. So at this moment in time, I would say my primary would be school food programming. And that means funding and support for bringing together all our school boards. So we have 3 different boards in the Bow Valley, and currently they don't really speak. So maybe food is one way that it binds us together, considering what's happening at a national level. And it includes bringing the nation more into discussions. And as a member of the Bow Valley, like right now, we're always considering them separate. So bring it all together as school and school food for all of our kids.
Michelle or Lauren?
I'll jump in because it probably affects me a little more personally. Affordability. So just looking at how the many different ways we can actually affect affordability through just putting that very subtle food lens on in all of our work. Lauren speaks to this very beautifully, but those values are, they overlap, they're ands. So to just make sure that we have that affordability lens as a whole in all of our work, I think for me that one impacts me personally and the community that I resonate with the most. Single income, that kind of stuff. So just to see that thrive a little bit better.
Thank you, Michelle. And so I would say for me, the first thing that comes to mind is food justice. So thinking about the ways that, you know, if our society or our communities aren't meeting the needs and empowering empowering community members who are most marginalized or who experience the most kinds of marginalization, then for me, you know, this work is that's really where this work is. And I think the other thing is we've seen some of the most innovative and community-based and impactful programs come from fairly informal, although not entirely informal, but like cultural groups in our community who are doing this work in their communities, who are working with temporary foreign workers and undocumented folks. And for me, that work I think is at the heart. And also, as Michelle was saying, not seeing some of this work as either or, like either we have affordability or sustainable food. And that's not to say we can have everything right away or that there's not, but it's to understand that our vision and the food charter's vision is really not for an either or, like it's either this, we either can have food, cheap food or, you know, organic food, but really to think about what are some of those tensions and then how do we move forward so that, you know, everybody has access to the kind of food that they want. Everybody has the ability to celebrate meaningfully the kind of food, you know, ceremonies and rituals that are meaningful to them. you know, how do we, anyways, I'm just going off on a tangent, but really thinking about, you know, broadening the way that we think about food and not putting things as either or, like either we can grow food here or we can't, right? Yeah, so that's my meandering answer. Thank you.
Thank you. I appreciate all three of those answers, and great question, Councillor Faber. Any other questions from council? Councillor McCallum.
Thank you. Thanks for your presentation, ladies. What I found really interesting about your presentation within our package is two things. Firstly, like, although the food bank in Canmore is mentioned, it's not heavily mentioned. And yet it is the go-to that most people in Canmore donate to when it comes at like Christmas time or holidays, or in the before times when we used to have community potlucks and things like that. We would always bring a food bank item. But also in the, I read in here, and of course I've closed it, basically that food banks would not solve food insecurity issues. And I was wondering if you could speak a bit more to that, please.
For sure. Is it okay if I take this one?
Yep.
No, that's a really great question, and I really appreciate it. So food banks are obviously incredibly important, and we have, you know, we obviously very much respect the work of food banks. And, you know, even to broaden that out to, you know, programs such as the Good Food Box, Food Rescue, and the Food Bank, like these are all really essential programs in addressing people's food needs now. Mm-hmm. However, they're not going to solve the problem of affordability. And I think it would be, sometimes it's easy to get caught up in the feel good stories and be like, look at all these programs we have, it's amazing. And yes, it is. But, you know, to me, the existence of these food programs is actually a signal that there is this very serious underlying issue that has not been addressed. Everyone should be able to eat, you know, culturally appropriate, nutritious foods. Everyone should have the right to do that without having to go to the food bank. And I mean, even the food bank itself says it's for emergency situations, or it's supposed to be for emergency situations. And so I think the work that the Bow Valley Food Alliance is doing and wants to do, and with this charter too, is expanding our understanding of food and solutions to things like hunger and food insecurity. Yes, food banks are very important. We really appreciate the work that we do. They are a short-term Band-Aid. And, you know, ideally we don't want food banks to exist anymore, right? In our ideal world. We want people to be able to have access, to have that right to eat food in a dignified manner. And so in terms of thinking about food banks as not solving, as you mentioned, Joanna, and we reference Proof, which is a interdisciplinary North American-wide research project that does a lot of research on food insecurity. They really focus on things like a universal basic income, which obviously, again, is we're not suggesting in this context is that, but that there's other things that need to be addressed, and affordability and poverty are really at the center. So our job as the Bow Valley Food Alliance is not to be like prescriptive in what will work or what doesn't work. Our job, as we see it, is to listen to what community members want and need, and then to try to push that a little bit in a direction that doesn't just stop at things like the food bank. And I think if we're listening, or at least for me, when I'm listening to folks who are really at a grassroots level, they are pushing that envelope already. And it is, I think, it's easy and it's a nice story to be like, I just need to donate some food. And again, it's important, but it's not getting to that root cause of food insecurity. Does that answer your question, Joanna?
Yeah, it does. I'm going to have another question though.
Yeah.
And I think it's because, you know, as I said before, our food bank in Canmore is really a universal catch-all for our community. So there, I guess, and there are different models, as a child growing up, we accessed the food bank quite a bit in our family. So I have seen many different models over my lifetime. And actually the food bank was the first volunteer opportunity I had when I moved to Canmore over 22 years ago. And it was where I first started meeting people. But what about our current food bank model in Canmore? Could we change or alter to integrate better with this food charter concept that you're bringing, Council? What is it? What role could the food bank play within the Alliance? Because I think that the Alliance is going to have an interesting time, I won't say difficult, interesting time, bringing this forward in absence of a partnership or some sort of arrangement with the Canmore Food Bank. Or with the Banff Food Bank, like every community has one, right? So
totally. And I think, again, these are really important questions, and we do have a relationship with the particular with the Bow Valley Food Bank. And I think part of the difficulty about this too is food banks have a long history of trying to be apolitical in terms of some of their approach. Certainly not all food banks, but when I've talked to folks both in Canmore and Banff, the impression that I got from them off the record is that, well, I shouldn't say off the record, but that they provide food to people, but it's not in a politicized way. And certainly arguably we can, we can say that everything is politicized, but that we also see the food bank as a very important player, but they're not the only player. They really address just food access. And when we think about that food systems approach, we're also, we're connecting to local businesses, we're connecting to, restaurants, we're connecting to community gardens, we're connecting to people who are growing food, we're connecting with all kinds of groups doing different things. So we see, I guess in our perspective, we see the Food Alliance, or rather the food bank, as a very important player, but a player that just addresses, I shouldn't say just, a player who addresses a very important and key part of the food system, but who really just focuses on food access. And we certainly partner and talk to them about issues of food access, and they've been very supportive in terms of being connected with different groups who don't have access to the same amount of resources as the food bank does, and supporting.
You certainly have access to a lot of financial resources, and I think I'm kind of going in that direction as sort of where my questioning is going, and it's not even just about financial resources. They have a wonderful building that sits empty part of the time, part of the building, not the whole building. I don't want to, and it's been a while since I've been in that building, but I guess I think that I have a hard time. I understand the emergency access piece of it, but I guess I'm just wondering from a more grassroots perspective, is there other types of roles that the food bank could play within the larger alliance? And it's a question through the whole discussions about the alliance over the last few years that has glared at me from the page, but we can talk about this more another time. I'll let my colleagues ask questions. Thank you.
Thank you. Looking to the rest of council, do you have any questions? Councillor Ma?
Thank you so much for the presentation. That was great. I can see the connection between how you talk about the affordability piece plus the food charter piece. Could you talk more towards, say, the climate action piece, as how it relates to all this as well? Because I think just for our community that's watching this, that could be great for you guys to speak to that a little bit too. Yeah.
So I'll just speak a little bit from my lens of being more social entrepreneur and seeing the climate portion from an agricultural perspective. So for me, it's always been about questioning where your food comes from, So not only just local food about miles and things like that, but also how it's grown, how many inputs have been used, and what systems those inputs support. So that has always been my climate lens, which is quite hard for a lot of people to see, especially in the Bow Valley, where we are disconnected from where our food is grown, because we're so programmed and used to having food in a grocery store. Like, you can go in the grocery store, it's there, you never have to question it, you never have to question how it's grown, or think about how many miles it came from, who grew it, like how many temporary foreign workers were used to grow the food, until you go to the checkout, when you see how many foreign workers they have to bring in for the grocery stores. So that has been my climate lens. And I would say over the last little while, I am starting to see how food justice and social justice in general can further the dialogue of climate change. And I don't want to go into details of it because I'm still working on how to process it in my own story. But I know that's a big part of it in terms of climate. So bringing social justice with the lens of food justice, because honestly, it's an easy one, to the table is, I feel, the beginning of really starting to talk about climate change.
Thank you.
Thank you. Any other questions of council? Well, seeing none. Oh, just under the bell, Councillor McCallum.
Sorry about that. I'll be straight up. I have been, as much as I believe in it and I support it, and I think it's a wonderful initiative with the Food Alliance, I have really struggled with the town signing on to it, because it feels like we're signing on to it and we don't really know what's going to be asked of us on the other side of that. And so I was wondering if you could provide for me some examples outside of what you've provided for Councillor Faubert, of some things that will be requested of the town of Canmore should council choose to sign on to the alliance, to the charter, sorry.
Lauren, do you want to take?
Sure, Councillor McCallum, thank you. I think this is the key question, right? That everybody wants to know, and certainly we've been asked by multiple councils in this process. So at this point, the ask is that the charter is used as a lens or as a document to think about council's work more broadly. So when council is thinking about housing, how is food connected to housing? And is there a potential win or opportunity to address both housing insecurity and food insecurity at the same time? And this can go as well for transportation issues, for example, in thinking about how do we ensure that community members who may not have access to cars, but who live far from a grocery store, how are they connected? Can they easily get to a place where they can buy fresh, affordable food? And we have certainly heard stories about young parents walking very far distances just to access like fresh snacks at parent programs. And so I think the idea here is, and this is not a concrete ask, it's right now, it's an ask for council to consider how food could be further integrated into the work you're already doing, and into work that looks at issues that may not be currently connected to food or may not be, front of mind connected to food. And that, I think, is where some of the different values in the food charter come along.
Mm.
And I think the idea of the charter is, you know, of course, to do actions, but there's no, like, we don't have like a list of actions that we're going to ask every council to do after adopting the charter. I think this is a recognition that food is an important part, and that moving forward, we're able to have a common ground to have conversations about what some of those actions might look like. And I know that's maybe a little bit of an airy fairy to leave it there. And I understand why council might be nervous about getting into a situation where it's like, well, you signed this, so now you need to do this, but it's not the intention whatsoever. The intention is really, the intention is to provide a document that says these responsibilities are all our responsibilities to consider. None of us can do all of this work, but rather that we are thinking and understanding from a similar starting point, that these are the things that matter around food. And so the ask really is to recognize that food is important, to be open to conversations, and to be open to talking about what that means. But this is just, it's a conversation starter, not a now you need to do these things starting place. And I guess, you know, my question is, how do we, you know, how can we assure council that they don't feel like that's the spot that we're leaving them in, because it's certainly not our intention. But I see Councillor Ma has a question, and I don't know if Michelle or Avni want to add anything to what I've said.
No, that's good. Just as a guiding document, we're not, there's no.
And so so I'm going to push back a little bit, because, and it's, I believe in food. I believe it's important. I don't grow it myself. I do buy it from farmers, whatever. I think, so is there a moment here where we as a council are going to be asked to consider food over climate change, food over affordability, food, because that's, I guess,
I think that this,
in the last few years, as we have committed as a council to, you know, putting things before others, we've had those things thrown back in our face. And so I feel after 11 years in this gig, I'm a little burned. And so I you know, like if there's certain things that I have signed on to and stuck my hand in the air that I wish I could reconsider, actually, because it's been used as a weapon, and not because we are, as a council, completely blind to what's being asked or the issue at hand. It's just that there's so many competing priorities. And so I guess I just want to, that's actually been one of my largest concerns, is that signing on to the charter is going to be weaponized against the community and against this council and against me as an individual. And I just want to understand how that won't happen.
Michelle, go ahead.
Yeah, I wouldn't mind just jumping in and saying, I really appreciate that perspective. And that's kind of what we're bringing, is just perspectives. Something we addressed really early on is we're really trying to create the and conversation. So how does food fit in and affordability? And so that's how I move through this document, and it weaves into those deeper conversations. But it doesn't, for myself, it doesn't prioritize it unless that's what my priority is. And so I feel like connecting the Bow Valley in agreeing and adopting this food charter is just giving more open ears to the different ways you can hear about food, and not necessarily prioritizing it, but incorporating it. So that and piece, again, maybe it's not sitting the same as constructing, and I just don't see how my conversations and how I've been moving through it. I actually have been able to insert food and to these everyday conversations rather than prioritize it. because it is that basic need. And it does actually unite a lot of the conversations about affordability and housing and these things. So for me, it's the conversation starter. It's the uniter, and it doesn't leave anything alone. It includes, it's joining in. So just big emphasis on and up to the community. What the Bow Valley Food Alliance is trying to do is amplify voices, not to speak our voice, but to hear what Canmore and Canmore's community is saying, and the municipality and council. What are all of these folks saying, and bring that conversation together. So there aren't priorities, but there's more voices. There's more collaboration and connection.
And so what would you say about the statement where around the fact that more and more, and I spoke about this during the Three Sisters hearings, actually, about because people feel less connected to other levels of government, they keep coming to the level of government they feel the most connected to and asking everything from them. The level of government that has the least resources, the least ability to tax, the least ability to sort of differentiate between incomes and so on. What would you say to that statement, that maybe this isn't the right level of government to be asking these things from?
I think that in my perspective, what we see with the food charter here is this is sort of our community-based understanding of food. And the municipality is just one level, both, that has many other scales above, including provincial, national, as Avni mentioned. She's involved both provincially and nationally in these conversations. And that because this is a community-based Bow Valley centric, we really feel that municipalities are one of many actors who might be interested in using this document as a reference point for thinking about food. And I hear your concerns in terms of, are we going to be asked to prioritize food at the expense of other things? And I think for me, the language of the charter is, we value, and then as signatories to the Bow Valley Food Charter, we value vibrant regional economies, the earth and environment, knowledge and education, collaboration and diversity. And it's not saying like we prioritize these things in relation to food. It's more so, I guess, acknowledging that this is important. And we are very aware that, we cannot do all things at all times, and we don't expect municipalities to be able to do them either, but that having a common understanding of what are some of the important things and considering them when making decisions is where we're going for, not necessarily that all our decisions are going to be like, okay, it says in here that, like food is important. So, we've got to have a grocery store in every new development, right? Like that's not, that's not, I think that's not the point. And even sometimes it's really that consideration of food, bringing it into the conversation rather than making it the conversation. But it happens to be the conversation that we're having. So, that's certainly the conversation we're focusing on, but we don't expect everybody else to be focused on that conversation.
Yeah, and so I know that I've asked I actually been hesitating for the last 2 days since reading the agenda on asking these tougher questions. And so I am grateful for you for answering them. And I know that they're not the sunshine and roses questions, but I really appreciate you taking the time to address them. Like I know 2 out of 3 of you, one of you better than the rest of the other 2. And as you all know, that affordability and basic needs has been always something that I have been a champion of, and I have been, I've always prioritized in my decision making. So I appreciate you answering my tough questions. Thank you so much.
And they are really good questions. So thank you for asking them, and good discussion coming from them. I'm going to turn to Councillor Ma for one last question, and then we're going to wrap up on this delegation.
Great. Thanks, guys. This is for Avni. At one point in your presentation, you mentioned that I believe the federal government is allocating, as you said, $1 billion a year towards food security, and it would be
School food programming.
Okay, school program, and you noted it would be most likely advantageous to be a part of the food charter to expedite access to that funds. Could you elaborate on that, and maybe some other potential opportunities that you see coming down that could arise from being a part of a food charter too?
Mm-hmm. So at a national level, so again, literally this morning, the debate always, and I'm not saying anything that's confidential, because it's always a debate at national levels of how to get money out to communities, whether it's through the PTs, so provincials, territories, and nations, or going directly into the individual organizations. So that's where the discussion's at. The government hasn't made a decision. The folks in the community or the organizations that I'm a part of are advocating for a hybrid model to ensure that the money gets to the communities that need it the most quickest. So you were asking about how signing the food charter connects to all this, right? It would be that if the people within our community who are working on this particular program come to council and say, okay, here's the plan, here, we'd like to have a Bow Valley wide school food program. And, we might need, I don't know, it might be approval for some space in town to be able to store the food or something like that, or maybe a small grant to be able to afford the rent to store the food, something like that. So that's kind of where so by signing the charter, at least it's in your mind that this is where this is all going, like it's a big picture, to be able to see the big picture when the details come to you. I don't know if that helps.
Yes, thank you.
Thank you. Thank you to the three of you for coming and presenting today. Thank you to council for wonderful questions. I know that we've blown the timeline off of our agenda, but that's okay, because these are important discussions. What I'm taking away is I really appreciate the food and approach. In fact, in my mind, dealing with food security is dealing with affordability. Dealing with food insecurity is dealing with climate change. So it's a necessary part of those discussions. Now, I should tell you actually two things. First of all, as a food-related tangent, interesting to note that Community Food and Friends served their past the 95,000 dinners served mark last night.
Whoa! And
so that was a milestone. So I'd expect we'll get to 6 digits this year. But with regards to your question, will you sign on to the food? I'm sorry, I just lost the word.
Charter.
Charter. Will you sign the food charter? Well, I'm going to be like those reality show hosts and say, tune in next time when we will address the question, because we don't deal with these questions typically in the meeting that we're in. So what I'm going to be doing is I'm going to be making a motion in just a moment to have this come to the first or the next council meeting, and we will then address the question then. So tune in next time, and we will give you the answer. So thank you again. And before we go on a break, I will make a motion that I have it written down here. I move that the request of the Bow Valley Food Alliance to be placed on the agenda of the next regular council meeting for a decision. Any discussion on that motion? Seeing none, I'll call the question. All those in favor? Carried unanimously. Thank you. Thank you to you all. I'm now going to call a 10-minute break. So let's get back on at 10 after 3. Thank you.
Thanks.
Okay, I think we're all arriving back now. I see we have 4 members of council, including myself, back. Do we have Councillor Mayor or Councillor McCallum? There we go. There's Councillor Mayor. All right. I know that there's something that Councillor McCallum was also dealing with. She may have to leave the meeting within the next 10 minutes. So we're going to proceed with item E, or item C, minute approval. So turning to the minutes of December 21st, 2021 Committee of the Whole meeting. Does anybody notice any errors or omissions? Seeing none, then I will move approval of the minutes of December 21, 2021 Committee of the Whole meeting as circulated. All those in favor? Carried unanimously. Moving on to item D, staff reports. D1 is Climate Action Plan Update and 2022 Areas of Focus. And welcome, Amy, to the Committee of the Whole. Ms. Fournier,
Hello.
the floor is yours. The virtual floor is yours.
Fantastic. Good afternoon, Mayor Cressert and members of council. Just permit me a moment here, please, while I get my presentation up and running. There we go. I believe you should be seeing the full screen version. Yes. Excellent. I am very happy to be here today to present to you all an update on the status of our work on climate change mitigation. I recognize that my briefing and 6 attachments represent a huge amount of information, and I really thank you for the time that you would have spent going through that all. The intention was to provide a comprehensive overview of where we are currently at with climate change mitigation, to have that all in one place at the start of the council term. So today I have half an hour with you. I intend to try to get through the presentation relatively quickly so that we have time to have some discussion and questions afterwards. I just ask that unless there's a clarifying question on one of the slides, that we hold questions until the end. So what I'll do here is just give a little bit of background and then talk about the current status of the actions in the climate plan and move on to what the 2022 major work plan items will be. So starting with the background, this is the policy that guides the majority of our work on climate change mitigation. The Climate Change Action Plan was approved in December of 2018. At the time, these were the targets that were adopted along with the plan. So a 30% reduction in community-wide greenhouse gas emissions by 2030 and an 80% by 2050, as well as a corporate target. So corporate meaning our own municipal operations, namely our facilities and our vehicle and equipment fleet. And because we have greater control over those, we have an increased level of ambition of 50% by 2030 and 80% by 2050. I should know that at the time, these targets did mirror the federal government targets, and that's part of the reason why they were set, excuse me, as they were. The federal government has, however, updated their targets. So last year, in response to more recent science that indicated that in order to keep global warming to 1.5 degrees Celsius, that we needed to up our level of action. So the federal government adopted a 40 to 45% target by 2030 and net zero by 2050. We do still, however, are working towards these ones here on this slide. And I will note that especially for the community-wide targets, these ones will be challenging. We don't have a lot of control over a lot of the community emissions in Canmore. The other policy that guides our work, of course, is the Climate Emergency Declaration. This was set in October of 2019. And really the intent was to acknowledge the severity of global climate change and to reaffirm that this was a priority for the town of Canmore. This doesn't have specific actions associated with it. Was really just a reaffirmation of the importance of our work. And so still the climate change action plan is what guides most of the initiatives that we undertake. In terms of where all of our greenhouse gas emissions come from, really it is the collective impact of all of our homes and our businesses, hotels, our institutional buildings is really the bulk of where our emissions come from. And it's from them utilizing electricity and natural gas for heating. Our second biggest portion of the pie is vehicle emissions, so transportation emissions, followed by waste. Within this pie, our own municipal operations or our corporate emissions account for about 4% of the overall total. Our climate action plan has 65 separate actions in it. Really, though, they can be lumped into one of these 4 categories. So it's about having more energy efficient buildings, using renewable forms of energy, getting around by walking, cycling, public transport, and electric vehicles, as well as reducing our waste. The climate action plan has both actions for us as a municipality for our own operations, as well as for the broader community. And those really require the collaboration of multiple stakeholders. So where are we at? About half of the actions in the climate action plan have either been implemented, are in progress, or will be started this year. The attachment number 2 provides this in much more detail. So I essentially went on a line by line kind of form and updated the status of all of the actions, but I put a few here for examples. I did want to just quickly in this presentation touch on the difference between the completed actions and the ongoing actions. So the completed ones are where it's a discrete kind of action with a finite end, ones that we can tick off and say that we've done and now we can move on. So inventorying Canmore solar potential, for example, we have completed the studies and considered that action complete. Whereas ongoing actions are ones that we will continue to implement over time. So installing solar on municipal buildings, we've done a huge amount of work in that regard, but we will continue to do so where appropriate. The in progress actions, the renewable energy feasibility study, there's 8 different actions in the plan that specify exploring or considering different forms of renewable energy. So what I've essentially done is rolled those up into one study and to look at a number of different options and approaches at the same time. So that work is underway, as is our clean energy improvement program. I won't get into detail about the 2022 actions because I'm going to discuss those later on in the presentation. Of course, while the climate change action plan guides much of our work, we still undertake initiatives that aren't specified in it. In some cases, this is because work is led by other departments and under additional or different strategies, such as the integrated transportation plan or integrated parking management plan. So for example, paid parking implementation will result in greenhouse gas reduction and help us move towards our targets. In other cases, we respond to community requests or upcoming opportunities or emerging opportunities, I should say. This photo, for example, is from a compost giveaway event that we hosted last June, which enabled residents to access the product of all the food waste diversion that's happening in town. So how do we know if it's working, if all of these different actions and what we're doing is actually helping us get to our targets? How we measure that is through the greenhouse gas inventory. This is a calculation of all of the greenhouse gas emissions generated within Canmore. The last one that was completed was for 2018. It did indicate that between our baseline, which is 2015 and 2018, greenhouse gas emissions had stabilized or really, had a very slight decline. I put corporate emissions on here just again to reinforce that notion that the ones that we have direct control out of are relatively small compared to the broader community emissions. And if we only focus on those, it won't be enough to meet our targets. We don't do a greenhouse gas inventory every single year because they are quite labor intensive. The next one, I will actually be undertaking one later on this year for 2021 emissions. And at that time, we'll have a better idea of how we're tracking towards our targets. What we do though, every year is look at some of the input data that goes into the greenhouse gas inventory so that we know what's coming and we're not going to be suffering any huge surprises. And we also look at some other indicators of progress and keep an eye on those trends. So this you have in your package. It is attachment number 3. It has a lot more detail, but I've pulled out some of the kind of highlights for this. I would say that, we want to be looking at 2020 definitely with note that it's an odd year given the impact of the COVID-19 pandemic, which would have influenced some of our data and trends. The things that we do note is that the number of Canmore number of vehicles that are registered to a Canmore address are up. Electricity and natural gas consumption are up. So this would indicate that Canmore is still growing. So it's not overly surprising to see those. But we do also have some positive trends. So waste was a bit down in 2020, and the things that we would expect, electric vehicle ownership is only increasing, solar photovoltaic installations are increasing, and Rome has increased since the baseline. So Rome's baseline is actually 2017 because that's when it was introduced. It did, because of COVID, was not as high as 2019 ridership, but it still was increasing compared to the baseline. So looking forward to 2022 and some of the major work plan items for this year. I already mentioned the renewable energy feasibility study. I will be completing that this year. So you'll likely hear from me again with some of the results of that work. Continuing to support commercial and residential food waste diversion and helping to grow those programs. I'm talking today about 2022, but we'll be back to discuss the implementation schedule for that, the 49% of actions that we have yet to undertake in the climate action plan. This work as well is being done with a lens of trying to not only advance climate work, but making sure that we're doing it in a way that is also advancing social justice, equity, and inclusion. These next 4, I actually have a slide on each of them, so I won't discuss them in detail now, but we'll provide additional details on each of these. So the Clean Energy Improvement Program. So this is something that's been coming for a long time. We've been working on it for a while now. We are going to start with the residential program. What the Clean Energy Improvement Program does is essentially allows building owners to finance the cost of energy efficiency improvements, as well as renewable energy installations, and pay those back over time through property tax, similar to a local improvement charge. The thing that is very special about CEIP compared to, say, a bank loan is that the debt stays with the property. It doesn't go with the owner, so that if a house or building is sold, the new owner will assume the repayment schedule because that new owner is also enjoying the benefits of those upgrades, namely reduced energy bills. We are working with Alberta Municipal Services Corporation. They are supporting all Alberta municipalities in delivering this program. So the upfront capitalization funding, the majority of it's being provided through the Green Municipal Fund. We are aiming to launch this later on this year. This is a big one. We are getting a new building code within the next couple of years. I flagged this for council because it is one of the most, if not the single most important policies to enable us to meet our community-wide targets. As Canmore continues to grow, every building that's built to current Alberta building code actually ends up adding GHGs to our community and making our targets harder to achieve. So the intent of a net zero energy ready code is that houses will be a net zero energy ready house or building is one that is built in such a way that the energy used over the course of the year could be met with a renewable energy installation on site. The federal government has been working on these for a while. They are saying. The latest update that I've had is that they hope to release them this quarter. And then we'll have a better idea of what's in the codes. So the work really for 2022 is for us to, once the codes are released, is to try to understand the kind of the stretch between what we're doing currently and what the code is currently, and what delivery of a net zero energy code will look like, and what we need to do to prepare. We still need to wait until we hear from the provincial government and what their plans are for phasing this in. So this is a lot of waiting game, but we can start to do some preparatory work in advance of this so that we can hit the ground running once it becomes adopted in Alberta. Next big piece is electric vehicle charging. So in just over a decade, if you or I were to go and want to buy a new passenger vehicle and we went to the dealership, the federal government is targeting that in 2035, all of those vehicles on the lot would be electric models. So this is something that is coming and that we need to be preparing for. KPMG did a survey last year across Canada and found that 68% of Canadians who were planning on buying a new vehicle in the next 5 years were hoping or planning or wanting to buy an electric one. That study also indicated that there still remains to be some persistent barriers for EV purchases, and I've included those here on the slide. So the first two, range and purchase price, there's not much that a municipality can do about that. That's really the vehicle manufacturers and potentially higher levels of government. But this last one, charging infrastructure, we do have a role. The image on the right is the charging pyramid, and that really just shows where it is fundamental and most important to have access to charging in order to enable electric vehicle ownership, and that's in homes. So we want to be looking at how we can support that and build that network. And in areas where charging can't take place at home, what is our role as a municipality to support that? The Circular Cities and Regions Initiative is largely an education and capacity building exercise. So we've been participating in this for the last number of months. It's a year-long pilot project. It's being led by the Federation of Canadian Municipalities, Zero Waste Canada, the Recycling Council of Alberta, and Receipt Quebec. It's a pilot project with 14 other Canadian municipalities who, along with Canmore, were selected. And they are supporting us really to try to support us to integrate circular economy approaches into our existing strategies and approaches, as well as future strategies. So the ultimate intent of circular economy is to move from this model on the left, which is our predominant model of the linear economy, to one similar to what's on the right, is kind of a more of a circular approach. And the intent is really to have materials and resources staying in use for as long as possible. So with that, I will invite questions.
Great. Thank you very much for that wonderful presentation and all of the information that you provided to council. It's all very, very helpful. Wondering if you could just stop sharing your screen for a moment so I can see council.
Sorry, let me just get my Zoom up here so I can press the button.
No problem. Yep, that works.
Is it gone now?
Yep.
Okay.
You bet. Great. Thank you. So I had a question.
Yes.
And I recognize this is difficult. It's integrated work. It relies on a lot of things beyond our control. But I am wondering about the different federal targets versus our own. And the way I see it is, if there's a federal target out there and right across the board, X is expected, and some do part of X, that means others have to do more than X. And so I'm just wondering if you had any comments about perhaps coming back in the future with a recommendation around moving to the federal targets.
Yeah, that is possible, and we may need to seriously look at that. We are members of the Global Covenant of Mayors. I didn't get too much into detail in the presentation just for time's sake, but there's some information in the package about that. And part of that commitment may be to continue to mirror the federal targets. So we haven't been asked to do that so far, but it is something that might happen in the future. And I think that it is the reason why these targets are the federal government and other organizations are updating their targets is because of climate science telling us that's what needs to happen. And I think for us to that and the globe in general, that the 2030 targets are really important. The clear message that has been given by climate science is that we just really need to ramp down emissions as soon as possible, and waiting till 2050 it will be too late. So that said, it's I'll be honest, it's a challenge. Like getting to 30% is going to be hard, especially because we're still growing. So I think my approach and what I'm really waiting on this new building code, because that will inform our approach. So if this new, not the model energy codes come out from the federal government and they are in a fairly ambitious timeline, and the province indicates that they will adopt those in a timely fashion, then we have a better chance and we can reassess. But until I haven't been comfortable coming forward until we have those, because that's a pretty key piece of the information.
Well, I appreciate that it's on your radar and definitely something to be considering, because if we're going to be keeping up with being part of the solution, we obviously need to look at that seriously. I see Councillor Faubert and then Councillor Mera with questions.
Thank you, Mr. Mayor. Thank you, Ms. Fournier, for your presentation and all your hard work on this issue. I had a couple quick questions on attachment 3, the energy, transportation, waste data trends.
Right.
When you look at this, what's exciting for you in terms of trends, and what's the biggest challenge we have as a community?
Ooh, such good questions. I think, so I'm just going to try to pull it up so I can refer to it at the same time. Number 3.
It's a lot of numbers, but
yeah, absolutely.
Together.
Yes. What is exciting for me, obviously there's some big numbers there, and it has to do with solar photovoltaic capacity and electric vehicles. So those are the exciting ones for me, because well, it seems fairly niche now, and part of the overall the numbers are quite small in terms of numbers of homes or numbers of buildings with solar rooftops, or number of people who own a battery electric vehicle. It is a relatively small percentage overall, but the amount of growth that has taken place for both of those in the last few years is what is exciting to me, because if those trends continue, and by all indications they will, that we will see a kind of a rapid increase in those, and those will help decrease our building emissions, and those will help decrease our transportation emissions. So that's kind of the exciting ones for me. And the on the flip side, especially natural gas, that's a tricky one, and that one is the really challenging one for me, because one, that is really driven by weather. So when on years where we have a particularly cold winter, we are going to see natural gas usage go up, and that directly impacts our GHGs. And natural gas is one of those things that, as we move forward and hopefully get to this net zero ready building code, that having buildings built with really high performing building envelopes just means that there's less heating demand, and that we can hopefully see that natural gas going down. But until we have that, all new buildings being built with highly efficient and start to kind of retrofit existing buildings, we will continue to see natural gas go up, especially when we have cold winters. So I hope that answers your question adequately.
Oh yes, that's great. And it segues into my other quick little one. under corporate emissions, natural gas consumed, there from 2015 to 2018, it jumps from 40,000 to 52,000. What did we add in our corporate, like what happened there? Because since 2018, it's remained relatively stable. And I do believe this is after Elevation Place was built.
Mm-hmm. Yeah, it did jump up. And I don't believe, and I could be wrong, so I would defer, and I may have to get back to you if I'm wrong about new facilities being added, but that could have, like, again, that is cold winters. Like our baseline year was a warmer winter. And so that's going to be a challenge for us because we may have years where we have a particularly cold winter. And so we will see an increase, but yeah, I don't believe that we added a huge amount of building stock. So that could just be usage and, trying to keep more users warm.
Great. I would just comment that you indicated that the building code is a big piece. SEEP is also a big piece. If we promote SEEP and get a lot of buy-in, and if we prepare so that people can actually follow through on their surveyed intention to buy an electric vehicle in the next 5 years and have some facilities here, we can move the needle. So
yeah. Absolutely.
Yeah.
I should say too, one of the things, and I'll discuss this in more detail when I come back with the inventory, but one thing that is on our side is that the electricity grid in Alberta is moving away from coal-fired electricity. And because of that, the carbon intensity of every single kilowatt hour produced and used on our side is going down. So it actually helps us to achieve our targets, because by doing nothing ourselves, we're actually seeing greenhouse gas emissions in our community go down. So that will help us in addition to those things that you mentioned.
Wonderful. Councillor Mara.
Thank you, Mayor Crowser. Thank you, Ms. Fournier, for your update. Both my questions were sort of touched on. When you're doing calculations for GHG emissions and you're comparing 2015 to current GHG emissions, do you I don't know how to word this, but do you take out the growth to compare the two to see, because I know the barometer has moved down, so it's going to move up. As long as we continue to grow, we're not going to see much difference in the two. Do you take the growth out when you do the calculation?
No, it's absolute. So, and this is done, and some metrics or indicators in different communities may report on kind of growth adjusted. Or like a kind of per capita greenhouse gas reduction goals, but our targets are absolute. So, there's a number of reasons for this. One is that is the guidance for the international protocols that we have to follow in order to meet our commitments. And so we report all of our inventory work up through Partners for Climate Protection, which is a Canada-wide organization, and the Global Covenant of Mayors. So that's obviously a global initiative. So, and it follows an international protocol for GHG inventories, and growth is not, accounted for in that. So we can, say that in the narrative, but like fundamentally for climate change, unfortunately, the climate will change whether, it's not forgiving. So it's happening whether or not. And so really it behooves us to work towards absolute targets. And so that's why I report on those and don't bring in the per capita ones. We also have a hard time per capita in Canmore, to be honest. Our population is transient. It's hard to get an exact number. And because we have part-time residents and so many of them, it could be false if we count those entirely towards our thing, and plus we have visitors, so it would be really challenging to try to have a meaningful number that is per capita based.
Thank you. The other question I had was regarding the electrical grid. You're saying that they're moving from coal-fired to, I'm sorry, what did you say they're moving to?
I didn't, because I was going down the road of too much detail, but mostly natural gas. So there's a big carbon reduction, even though it will still be fossil fuel fired. It is a big reduction compared to coal in terms of the amount of greenhouse gas emissions generated. So we will still have a high carbon intensive grid compared to other jurisdictions in Canada. And there's renewables. So the amount of renewables on the grid is constantly increasing. So it's going to be a mixture between natural gas, solar, wind,
Mayor Crosser, if I may, one more question. I'm just asking regarding the same, the electrical grid. If we move to including EV charging in all our growth, well, do you think the province will be keeping up, allowing us like for supply for that?
Yeah, that's an issue that comes up a lot, and it is a concern that gets raised with electric vehicles. And so I do like, because we're getting ahead of this, and that's part of the reason why I want to get ahead of these things, so that we can say like this is the anticipated additional load demand that could be placed on the grid. So let's plan for that. One of the things with electric vehicles is that they can be charged at off-peak times. So while the grid is designed, and thankfully for all of us, to have electricity come on when we need it at peak times. So vehicles can be charged outside of those peak times. So peak times tend to be like end of the day when everybody comes home and is using dishwashers and cooking things, and they have a lot of peaks throughout the day. Electric vehicles tend to be charged in the middle of the night. For a lot of people, they do get charged during the day as well. But for the majority of charging, especially at home charging, takes place overnight when the demand on the grid is much lower.
Thank you.
Excellent. Looking to council, any other questions? Councillor Ma.
Thanks for your presentation, Ms. Fournier. Just to clarify with the bylaw 20-26, 2020-26 with the SEEP, when it comes to applications, people can do multiple improvements per application, correct? So they can say like, hey, I want to change my windows and go solar panels. So they don't need to do 2 separate years, etc.
Absolutely.
Okay,
and
great.
we would encourage that. And if there's anything confusing in the bylaw, it's actually meant to try to encourage people to do it all at once. The program too, I'll just say that part of the requirement is to have an EnerGuide evaluation. And the intent of an EnerGuide evaluation is to say, benchmark the home in this example, and guide you on what the most effective strategies would be for your home. And so ideally you would tackle those all at one time, because they can be interrelated. So if you improve your windows, for example, you might not need as much, you might not have as much heating demand. So if you were getting a furnace at the same time, you could actually get a smaller furnace.
Right.
So things like that. So we definitely would like residents to consider their kind of house as a system and plan for those all at the same time.
Great, thank you.
Thanks.
Before going to Councillor Faubert for another question, I'm going to ask a question. Attachment number 1 is fantastic. I love this document. Actually, it's really comprehensive. I know that it was requested from local community groups. I wonder if we ever got any feedback on what was put together. I mean, going through all this effort and sending it out there, what was the response?
Yeah, I think it was good to have. The response is they're going to come tell you. So what part of that was to be open and transparent about where we were at in terms of our climate work ahead of the municipal election. I think that was the kind of intention of gathering that information. But the Bow Valley Climate Action Group had wanted to use this as a kind of a basis for further conversation and a reference point. And so the best mechanism for that is to come as a delegation, like your previous delegations, and present and to talk with you as mayor and council, kind of referencing this document. So the plan really was for them to come and do that soon. So they have signaled their intent to come as a delegation to an upcoming CAL meeting.
Fantastic, thank you. Councillor Faubert.
I just wanted to, Councillor McCallum had a question as well. And I know I've already gone.
Okay, Councillor McCallum. Is Councillor Faubert mind reading again?
I can't believe she's given up her opportunity to be all questioning. She's a professional question asker.
Yeah.
Thank you for coming to Committee of the Whole, Ms. Fournier. These are all great documents, and as a municipal geek, I enjoy reading them all. But I'm wondering, is there somewhere, someplace a spot where we have said we are 35% towards our goal. We are 40% towards our goal. Like, I get a lot of questions, and during the election, I'm sure many of my colleagues got these questions like, what are you doing about climate change? So we can name off all of our initiatives. We can talk about, and they're all very impressive, and I'm very proud of all of them. But at the same time, when it comes down to the nitty gritty, where are we at? And is there a spot where we can find that on our website, or is it something that's announced annually, much like our living wage number? Is there some place like that that constituents can look, or politicians can look, to see how we're doing?
It's a great question. So Mr. Robertson in communications and I have been chatting in response to this, and I think he made a similar point to the mayor in that, we have this great document, but it's a lot of information and likely too much. And we're trying to figure out a way to, in a concise way, share some of these details about some of our successes and some of the great work that we're doing on our website. The kind of response to your question about, how are we actually doing though? We'll know more later on this year when I do the inventory. And there's always there's a lag in the data, and I didn't want to do one for 2020 because it was a weird year, so we might be like celebrating how down we were on emissions, but really had more to do with the pandemic. So we've had to wait, and there's still a lag in the data. I won't get access to some of the data that I need until June, so I won't be able to do it until the fall likely. Right. But we'll have a better indication of how we're tracking towards our targets then, and that's the most meaningful, really. In terms of actual progress, so we'll know then. And it's great to hear
that your documents do show how, on an individual basis, we can make change, and I think it really opens and turns residents' minds to the task at hand. But I guess for people who are sort of they just want to know, how are we doing, and that's the only reason why I bring the question up. But I understand that the inventory is a massive piece of that. So I respect that.
No, and I think, but I mean, your point's well taken, and the communications folks and I are trying to figure out how to make that make it accessible without having to go through too much information.
Perfect. Thank you so much.
Thank you.
Just on that, it'll be great once we get to the point that we can see that and constituents can see it, because it will probably increase buy-in. Okay, this is where we are, and combined with what we put out and the biosphere puts out, and all of those things together, of how we can start to move that needle and really make it a community effort. Councillor Faubert, the questionee Councillor Faubert.
Oh, okay, and I'm not even sure that this is a question, if not just more feedback for what would help me, especially in terms of any update to our climate action plan and moving forward, is understanding what we can do with the resources we currently have, what we need more resources to do, and what's not our jurisdiction to do, and who we can advocate for that. Because I think, right, I'm reading it and I'm getting there's things in this plan that, right, it's just I'm reading the update and I'm getting the sense this information, this will help me in terms of prioritizing my decisions as well.
Yeah, that's a great point. And I will endeavor to do that with the 2023 to 2030 the implementation schedule. And I've been working on this since I started in 2019, just figuring out when we're going to do these things and trying to quantify the impact of the different actions, because we have these 65 actions in the plan. They're not all created equally. Some are easy peasy little things, and then others are these foundational massive things that will take a huge team to implement. And so trying to map that out. So all this is to say that thank you for your point and being clear about what would be helpful. And I take that as consideration in the work that I'm doing, that I will be coming back for.
Great, good point. Looking to council to see if there's any other questions. I have just one last one. Obviously, Canmore is a very special place with a breadth and depth of experience of all sorts, including with respects to climate action. And, you know, you mentioned the Bow Valley Climate Action Group. Is there opportunity or have you been taking the opportunity to engage with some of our local experts that can maybe help do some of the lifting?
Absolutely. And I'm quite proud of the relationship that the town has with Bow Valley Climate Action in particular. There are other groups and other individuals who are keen and working hard at this. And, you know, this is a community effort for sure. And I wish I could name all of the contributors in this community, but I'm mindful of time. So, but with Bow Valley Climate Action in general, you know, the relationship is such that they have kind of a dual role. One is to hold us accountable, and it can be hard to hear sometimes. But the other is really supportive. And so I do work closely with them to try to identify the key areas where we could use some support and some help and what we're trying to achieve. And we have a fairly open relationship about that. And so they do things like on Saturday from noon to 1, they're having a webinar with the Electric Vehicle Association of Alberta about what it's like to own an electric vehicle. So they have really taken on, said, you know, what are your key things that you're trying to achieve? We'll help on the community education and engagement side of that. Biosphere does the same. Like, how can we support you to do the community education and engagement work that needs to be done? So hopefully that answers questions, but that relationship is there. And I'm just having them listen to, you know, and ask the question, like, what's most important to you? What can we do?
That's very good. I see that Ms. Smithers would like to add to the conversation as well. So please go ahead.
Yes, thank you. As we're wrapping up, I wanted to take a moment and acknowledge the work of the previous council in both setting up the sustainability reserve and in taking steps to make Ms. Fournier's position a permanent one at the town with a climate action focus. I think, and those actions were actually themselves in our climate action plan. But I also just wanted to acknowledge in some of the great work that we're continuing, and by we I mean Amy, that we're continuing to do in 2022. Some of that is funded directly from that sustainability reserve that was set up. So yeah, just thought it was important to call that out as part of this overall picture. Thanks.
Great, thank you for that. And Ms. Fournier, in your answer about the Bow Valley Climate Action Group, you mentioned their dual role, and it occurred to me, I mean, that's of course very much council's role as well, is to hold accountable and to support. And I just hope that the Bow Valley Action Group, like I hope this council will prove to be, that we can do both amicably. Mm-hmm. And accountability does not mean, putting somebody's feet to the fire. Accountability can be done amicably and in a helpful manner. So I'm glad to hear that community, that relationship is developing. And thank you for your work. Really appreciate all of the work that you're doing. And it's no big or no small task taking on for the municipality as the lead point, the greatest challenge facing our world today. So thank you for all of your efforts and keeping this moving on our behalf.
Thank you to all of you. The same. Great. For all of your work and dedication to this.
Great, thank you. All right, let's move on to item E, Councillor Updates. We will go through this relatively quickly and use the same process as we have used in the past, going one by one, if there's any questions, and go in that way. So any questions with regards to my report? Okay, seeing none. Any questions with respect to Councillor Faubert's report? Oh, Councillor Faubert.
I just wanted to share that I had misdiarized my meeting with the Alberta Municipalities Environment and Sustainability Committee, so I will be attending that. So my update, I said that I had a conflict in my schedule, but I don't. So
isn't that's beautiful?
Awesome.
I love it when a plan comes together. So any questions for Councillor Faubert? All right, seeing none. Councillor Graham's not here. Councillor Hillstad, any questions for Councillor Hillstad? Councillor Hillstad's strategy is obviously inundate them with information, overload them, and just hope that they don't notice any questions. Councillor Faubert, you have a question, though?
Yes. I think this is a really great yearly update of the work for Canmore Community Housing. I had a quick question about the matching down deposit program. So this program you can access if you've applied for CCH and you're considered eligible and you're on, but you can use it to buy a house
market
in the market. So you can use it to not buy a CCH house, but to buy any other house out there in the market right now. You can get $25,000 matching grant for your down deposit.
Correct.
And it's not been fully subscribed. Is this correct?
Oh, yeah.
Ms. DeSoto.
Just to clarify, it's not a grant. It's basically a very low interest loan, right?
A matching down deposit.
A matching down deposit, yes. But it is to be repaid back, which is different than the accessory dwelling grant, which is a pure grant that does not need to be paid back.
The grant has other requirements. You have to, for X amount of years, keep your rent for that accessory dwelling suite within the CCH range of rent. And so there's other factors to it for the grant. For the matching down deposit, it just gives you money towards down payment, which does have to be repaid. And I can't recall off the top of my head what the interest payment is. It's low though. I want to say it's 1%, but I could be wrong. So I don't have that off the top of my head right now. But yes, that it can be used to purchase market house. Because again, if we have someone on the wait list and that's enough to push them over the edge to get into market, just means there's less people on the wait list for other stuff. So yeah.
Good program. All right, any other questions to Councillor Hillstad? Okay, next is Councillor Ma. I have a question for Councillor Ma. Did you not submit a report, or did you simply have nothing to report?
I didn't have anything to report, sir. Yeah, all my meetings lined up, so they're bracketed outside, and I can defer to Councillor Mara for Bow Valley Waste Management Commission for her report.
Okay, good. You avoid the warning ticket then this time. We're going to start with warning tickets, but we want to get to the point where we're 7 for 7 for reports, and there might have to be some donations to a charity if anybody misses or something like that.
I just don't have anything to report.
Okay. Then I won't ask any further questions.
Okay.
Thank you. Councillor Mara, any questions for Councillor Mara? Councillor Faubert.
Order question. My question is with regards to the monthly bulletin. Is that okay?
The
From
Bow Valley Regional Housing. Yeah, I think that's within the within her purview. Yes.
So the capital cost update for this is home phase 2. Government of Alberta has committed 16.5 million, which means there's 900,000 to fund. How is Bow Valley Regional Housing looking at funding that?
Oh, you're on mute.
That would help if I had that off. It's been put away been building for a while. It's a reserve that was to be used for this purpose. I don't know if that's as simple as you want the answer or you want further.
So do you have enough money? Is there enough money in the reserve to cover that shortfall as well as the furniture and furnishings and all the other stuff that's not covered?
Yes.
Okay, so we're not looking at another requisition?
No.
And then that difference, is that just like budget in terms of final construction overrun, or like the difference between the 17, like why, is it over budget? Or it was always,
I'll let Councillor McCallum defer to this
Okay.
question.
Councillor McCallum.
So I'm happy to explain this one. So when this project was envisioned several years ago, it was identified to the province from Bow Valley Regional Housing that there wasn't enough money, that they were not assigning enough money for the amount of work that was required to build the building. And all along we were told, oh, don't worry about it, we'll find the money. Don't worry about it, we'll find the money. Don't worry about it, we'll find the money. And then COVID hit, and they were looking to get rid of the project, actually. And they used that $900,000 as a reason, because we always knew it was $1 million underfunded from their budgeted numbers. And so to make sure that the project actually happened, we as a board decided to use our reserves to address that $900,000 shortfall. We had a very short window of time in which to do so, because once the building code changed, then there was going to be another $750,000 worth of expenses that were added, $500,000 actually, sorry, to the project. So basically, the taxpayers of the Bow Valley saved the project through their contribution of tax dollars, local tax dollars of $900,000. The one thing that we are stuck with right now, and our executive director is backing and forthing with Alberta Seniors and Housing, is a generator. All along, we had identified that a generator for the life-saving services that are going to be within phase 2 would be required. And Alberta Health Services and Alberta Seniors and Housing are having conversations about this. We don't feel the building should be opened without that generator. So we will see how those conversations continue. That could be a potential, that could be potentially something that they come to us for, but we are not really keen to fund that. That is health care, and that should be funded by the provincial government.
Okay. Thank you for the tag team on that. Excellent. Any other questions for Councillor Mira? Okay, then moving to Councillor McCallum's report. Any questions for Councillor McCallum?
Councillor Hillstad had a question.
Oh, Councillor Hillstad.
I just wanted to clarify on the questions that were asked of me, just quickly jump to the CCH website. So just to be clear, the matching down deposit is $1 for dollar up to $25,000 by the way of a second mortgage. The second mortgage would be loaned at a rate of 1% simple interest for a 5-year term, with the option of being extended for a second 5-year term. And the purchase price of the property being acquired must be $800,000 or less net of GST, and it must be used as the purchaser's primary residence. So there are a couple other things on the matching down deposit that are there. So just wanted to clarify that, since I threw out 1%, and luckily I was right on that, but there's some other things too. So
thank you for that clarification. Questions of Councillor McCallum? Seeing none, we will now move to administrative updates, which of course is section F in the agenda. Let's first turn to any questions in section A, municipal services. I have one question, and that's with respect to 1C around the Home Society of the Bow Valley, and it's looking to reopen next month. What location are we looking at, or is that still to be determined? Can't unmute. Oh, there you go.
Sorry, I needed the host, I think, to unmute me, or I was doing it wrong. Anyway, I don't know. I haven't had confirmation of that yet, but once Ms. Brown has it, I can ask her to update.
That would be fantastic. Thank you.
Yeah.
Okay. Any other questions in section A? Okay, seeing none, moving to section B, corporate services. Any questions? Councillor Faubert.
Thank you, Mr. Mayor. My question is facilities, sub tab C, rec center rooftop solar.
I think we're on the wrong one.
That's infrastructure.
That's infrastructure. So looking at B,
Oh.
corporate services.
Sorry. Okay. No, but I'll just stay and wait for mine.
Okay. Poor Miss Rogers got all her hopes up. She's going to answer the
I'm sorry.
question. And you just pulled the rug out from underneath her. There you go.
Think of a question.
I know you can. Why don't we move to section C then, under facilities?
Okay, so I can. Is it okay for me to ask my question?
Yes.
Okay.
Yep. Go
So
ahead.
the additional weight of the rooftop solar is not going to be supported on top of the gymnasium at the rec center. So administration, it says in the last sentence, working with a structural consultant to determine if there's capacity to support rooftop solar at the salt sand shed at the Elk Run Road maintenance facility. I guess I was wondering why we didn't, if that location was chosen due to the size and potential, or if it was possible for us to address Arts Place, the daycare, or the senior center.
Yes, thank you. It's a good question. And we have actually prioritized all of the opportunities we have available for rooftop solar based on the size and the orientation of the rooftop and just being able to maximize the kind of the bang for the buck for solar panels. So that salt and sand shed is the next one on the list because it's a substantial rooftop with the appropriate orientation. And we feel that that's where we're going to get the best value for our money.
Great.
And I did have my hand up because I do have a couple of additional kind of late breaking updates.
Go for
that
it.
Might answer some questions.
We're going to our reporter in the field, Ms. Smithers. What's
Very
the latest
exciting.
on the update? Yes.
There needs to be a ticker tape feed or something. So I'm going to share my screen. I have some sad news and then some good news. Okay. So I'll, if I can share, and I'm not going to go all fancy presentation. I'll just leave it rough. Okay, so I will start with the sad news with the pond. So as some of you may know, most of you would know, during the deep freeze, there was a natural spring that emerged at various points in town, including affecting the surface of the pond. The good news was during that deep freeze, it gave us a pretty solid between 2 to 5 inch thick ice surface at the pond. The not so good news is that since things have warmed up considerably, that natural spring has stopped flowing. And we're now in a situation where we have underneath that kind of compromised ice surface, an air pocket varying between probably 6 to 12 inches under the ice surface. The ice surface itself has started to slump because of that air pocket as it warms up. So you can see coming off of the steps, there's a slope down to the current surface of the ice, and it's actually hollow underneath that. As well, the benches that we've had on the pond surface are pretty much islands in the middle of pretty soft, slushy ice, and the ice is too compromised for us to be able to put equipment out on it at this point. It is getting colder today, but then with next week warming up again, it is not looking good for the pond, and we don't have a high degree of confidence that we will be able to restore it at any point this winter. So we'll do our best. Things change as we've seen over the past month. The weather patterns certainly change, but at this point, it's looking like the pond will be shut down for the remainder of the winter. So I wanted to provide some update because the current administrative update indicates that all of our ice surfaces are open. These pictures are as of yesterday. Right now, obviously, there's a good layer of snow on top of all of this. So I wanted to give council an update on that. And then if it's oh, sorry, I can't see anybody now with my screen sharing. So
I was just saying thank you.
Okay.
Yeah.
And then my second update, good news. And I know one of you for sure will be excited about this. This is a picture of our new control box. for the interchange, or
Oh,
intersection, I should say. Very exciting. So I won't keep that on for a very long time because I can't really speak to it. But what I can say is that it arrived in Ontario in December, was certified through CSA. It arrived in Calgary today, actually. So we are hoping it will be installed. Well, it will be installed and up and running next month. It's not going to be like, it is an incremental change in the functionality of that intersection. So it will smooth out some of the optimization and allow us to do more with the signal optimization. But it is that incremental improvement that we're going to see. And then the last part on the intersection update is we also have parts ordered to lower the signal heads, because that has also been a standing concern. Those we are expecting, again, there's some delays in shipment there. So we are expecting to have those in and installed March or April. So those are my late breaking updates. I hope they were as exciting for you as they were for me. And thank you.
They're thrilling. And I appreciate that after I've given a community report to those, that effect, that I'm not being made a liar. So I really appreciate that. And as you said, for the incremental, I think Mr. Asarte, he showed us some numbers and a graph, and it showed certain points where it sort of went over certain amounts, and it will help smooth out those types of things. It's not that it's going to change everything, but it will make some of the worst times not as bad. Right. So thank you. Appreciate that. Councillor Hillstead, you had a question on section C.
Well, one of it just got stolen away because I was going to ask when that thing was going to arrive here, and it's now in Calgary. So that was one of my questions. But the other one was with the down in the same intersection, the pedestrian lights for the walkways have been strobing, but then I drove by and I saw people fixing them. But I know that there's still some that look like they're either burnt out or not turning on. So I'm just curious what kind of update you can provide with regard to those lights. I know that a lot of the strobe effect has gone away, which is great. Just curious on what other things are happening down there.
Well, thank you. That wasn't part of my late breaking update because I don't have any pictures, but it is an item that we are aware of, and we've been working with the contractor on fixing that. It is a warranty issue, so it will be covered under warranty, and we are working on straightening that out.
Great, thank you. Mr. Soda, do you have anything you wanted to add? No, you're okay. Okay, any other questions on section C? Okay, seeing none. Moving down.
Councillor Mara has a question.
Oh, Councillor Mara. Yes.
I'll get used to that 1 year. Under Public Works, section B, I was just looking at, we were looking at snow and ice removal. I was just wondering if we're still doing enhanced, I guess, road clearing, or where handicap spots are, if we're still doing some extra cleaning of those areas for the handicap spots on Main Street or anywhere downtown.
Yes, so there is an enhanced level of service stipulated in the snow and ice control policy approved by council for those handicap stalls, and we are doing snow and ice control in accordance with that policy. So yes, as we have been directed by council.
Thank you.
You're welcome.
Any other questions with regards to anything in the administrative report, administrative update? All right, I am going to move on to council resolution action lists. Any questions, comments around that? Seeing none. And well, we already had one question on the Bow Valley Regional Housing November Bulletin. Does anybody have anything else they wanted to ask? I see none. So we went over, but we dealt with some big issues and some wonderful conversations and some excellent questions. Councillor McCallum, I'm glad to see that you're able to stay. And thank you all for your participation today. I will now move that we adjourn this committee of the whole meeting. All those in favor? Carried unanimously.